I'm calling the 450th Council meeting to order. Welcome, everyone, and thank you for joining us today. We are live streaming this meeting through the RCDSO's YouTube channel so that members of the public, profession, and other interested parties can watch our proceedings. I would now like to turn to the official opening of our meeting with a land acknowledgement. The RCDSO is on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples. These traditional lands are known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is home to many diverse First Nations, Inuit, and Métis peoples from across Turtle Island. This land is also part of the Dish with One Spoon territory, a treaty between allied nations to peaceably share and care for this land. We accept our responsibility to each other and this land we live on and work on in a spirit of peace, friendship, and respect. We are committed to actively supporting the necessary work towards truth, reconciliation, and equity. We embrace the role we play in regulating dentists, in protecting the public interest, and in strengthening our partnership with Indigenous communities to advance access to safe and equitable oral health care. Thank you. And at this point, I'm going to turn it over to Dan to do the roll call. Dan, please.
Thank you, Hanno. So Council, please be prepared to unmute and let us know that you're here, starting with Nalan Bhargava. Okay, I think Nalan will join us shortly, I hope. Ram Chopra.
Present.
Jamie Colliver.
Present.
Peter Delane.
Present.
Ellie Fisher.
Present.
Daniel Fortino.
Present.
Neil Gajar.
Present.
Noha Goma. And Noha is going to join us. Daniel Haas has sent regrets. Iliad Horner-Parvar.
Present.
Vivian Hu.
Present.
Nizar Ladak.
Present.
Anthony Licio. Okay, I understand Anthony will be joining us. Anthony Mayer.
Present.
Harinder Sandhu.
Present.
Brian Smith.
Present.
Usama Solomon.
Present.
Robin Somerville.
Present.
Rod Stapleforth. Okay, Mark Trudell. I believe we're expecting both Rod and Mark, so we'll watch for them. Aaron Walker.
Present.
Judy Welakovich. And Deborah Wilson.
Present.
Thank you, Hanno. Back to you.
Thank you. And Dan, I just saw Noah has just come on.
Okay, thank you.
So welcome, Noah.
Thank you.
Thank you. So at this point in time, I'm going to turn it over to Harinder for the president's remarks. Harinder, please.
Thank you, Hanno, and good morning, everyone. I'm pleased to see you all, Council, RCDSO staff, and all our observers. As you know, June is the season of graduations. It is one of the privileges of serving as president that I'm asked to say a few words about the RCDSO at each award ceremony. Every year, in a sea of bright faces, I'm inspired by the future of dentistry. Both Western University of Toronto graduates are excited and proud to be joining the profession. Just last week, Council spent a day and a half contemplating the next 10 years of oral health care delivery and our role in it. It was an inspiring session, and you will be hearing more about our deliberations in the coming months. Council, we have so many important topics today. With every meeting, we advance the profession. We become more focused on our mission, and we concentrate our decision on the public interest. Today, we'll spend time on some significant developments under the 2023 to 25 strategic plan. Our governance modernization project, which you heard about last year, has come to fruition. Our new governance committee has improved transparency, rigor, and accountability. The proposal before you today enhances the public trust and confidence in the college's ability to govern. We will also hear our annual financial report from staff and the FAR committee. This is a crucial part of our role in fiduciary oversight. As part of that update, there are developments on the PLP divestment project. This will be a time for change for the profession and for the staff. This important program will be maintained, but under separate ownership, and that will benefit the public, the profession, and the college. We will also be hearing about the ongoing improvement to standards of practice, new standards, impact day-to-day practice, and the team is working hard on easing implementation. This is essential to our regulatory responsibilities. I would like to conclude with some news about council members. Our colleague, Dr. Aaron Walker, has been awarded the Young Alumni of Distinction Award by Schulich Medicine and Dentistry. Dr. Aaron Walker is a healthcare policy advocate, legal scholar, and practicing dentist whose work bridges law, governance, and public health. Dr. Walker is very involved at the college, serving on the executive committee as well as chair of the inquiries, complaints, and reports committee. She has been an active member of the working group developing foundations of professionalism. Beyond her professional pursuit, she's an accomplished musician and passionate about the arts. Congratulations, Erin. Please give her a big hand.
Thank you.
Our colleague, Christina Cordero, has stepped down from council effective June 1st, 2025. Christina is a former Royal Bank leader and contributor to the Macau arts and culture. She has served council for almost 5 years. We are very grateful for all the Christina's contribution to our mandate, most recently for her service to our registration committee as well as the inquiries, complaints, and reports committee. Our esteemed colleague, public member Mark Tudell, has been reappointed for another 3-year term to serve alongside with us. Mark was re-elected to serve on the executive committee earlier this year. He has been of great assistance on the PLP file, serving on the procurement review group. And as you will see later today, Mark is the chair of the Finance, Audit, and Risk Committee, and his guidance is invaluable. It's a great privilege to learn and work alongside all of you at the table. In closing, I want to express my sincere gratitude to everyone who contributed to organizing this meeting. A great deal of effort happens behind the scenes, from creating hundreds of pages of materials to managing the intricate logistics of a hybrid format. It's no small task. Thank you to the dedicated staff at the college. Your support is essential to our ability to govern effectively. Dan, thank you for everything you do for me and for this council. Your leadership team, along with the entire RCDSO staff, plays a vital role in supporting our work. Council members, thank you in advance for your engagement today. Your thoughtful insights are truly valued. As always, there are a number of people who join us via YouTube. Thank you so much for your interest in college. With that, Hannah, I'll turn it back to you. Thank you.
Thank you, Harinder. Next on our agenda is the Declaration of Conflicts of Interest. It's a part of our meeting that aligns with the Ministry of Health College Performance Measurement Framework. And just a reminder, Council, that the college is working with PricewaterhouseCoopers on the PLP divestment project. And at this point in time, I am going to ask if there is any conflict of interest that is real or perceived to be declared on this agenda. Harinder.
I declare conflict to item 7.2, the third bullet, where it is discussion on staggered terms for the council members.
Thank you. Aaron Walker.
I also declare conflict with item 7, the staggered terms for council members, issue 6.
Thank you. Noha.
Yes, I declare conflict with regard to the item on the appointment of university representatives to council.
Thank you. And Anthony Mayer.
I declare a conflict with respect to item number 12, practice models and corporate dentistry, and so I will not be participating in that discussion, nor will I be voting on that matter.
Thank you. Thank you, Anthony, and thank you to everyone else who has declared a conflict of interest. Should something occur during the meeting that makes you realize that you do have a conflict, please feel free to declare it at that point in time. Next item on the agenda is the consent agenda. We use it as a governance best practice, as a time-saving mechanism. On the consent agenda are several items that are for council's information, acceptance, and ratification. You will be asked to approve these items in one single motion. If you have a clarifying question, that is something we can entertain. If, however, you have a conversation about an item, we will take it out of the consent agenda and address it later on at the meeting. Should you choose to do so, I just ask that that is a very high bar that you should consider when asking to remove an item from the consent agenda. The items for your approval in terms of the consent agenda were found on pages 13 to 247 of your meeting package. Are there any questions of clarification for any of the items on the consent agenda? Seeing none, could I have that motion on the screen, please? And council, the first motion for your consideration today. Okay, I'll just then quickly read it out, is that the following items be approved and or received for information by council. Approval of the agenda, approval of the RCDSO council meeting minutes of March 27th, approval of the RCDSO council meeting minutes of May 13th, 2025, council evaluation survey results, March 27th, 2025, registrar and CEO report, RCDSO council work plan 2025, financial update, RCDSO strategic plan 2023 to 2025, policy report, public member reappointment, and committee reports. 11 of them included starting with discipline and ending with registration. And I see that Vivian has moved that motion. Ram has seconded. Please raise your virtual hands to indicate your acceptance. And that motion is carried. Thank you very much. Please lower your hands now, council members. And the next item is the registrar and CEO's report. It is in your package, but I'm going to turn it over to you now, Dan.
Thank you, Hanno, and thank you, council. I have provided you with my written report as per usual, and I'm not going to go over it in any detail. I want to focus on three things today, and obviously respecting the time that we need for the lengthy agenda today. My first item that I want to just brief you on is issues that relate to health profession mobility and licensure or registration. And I think it's quite obvious to all of us that there's a lot of activity going on with respect to reducing interprovincial barriers for the movement of products and services, and healthcare professionals are a part of that. I want to just ground you first in some of the things that are already in existence today with dental regulatory authorities and the RCDSO. All of the dental regulatory authorities across the country have agreements for standard requirements and mobility, and we've had these agreements for years. So there has been and will continue to be mobility of dentists across Canada from province to province, and we have mechanisms, obviously, to work with those candidates as expeditiously as possible. We have been expeditious in all regards. So if you look at domestically trained who are applying for licensure, if you're looking at the mobile candidate, if you're looking at an internationally trained dentist, if your application is complete, we can license you within days, probably about 5 days or less. And that's been a consistent time over the last several months, if not years. Those are results that we, RCDSO, have provided to the government. And also our federation, the Health Profession Regulators of Ontario, HPRO, has communicated that all of the colleges are licensing health professionals very quickly already. And what we're trying to do is just to demonstrate that we are not barriers, that we are working very hard, and RCDSO is working very hard to make sure that we get individuals licensed very quickly, including those who are coming from other provinces or territories in the country, because we know that they already meet those expectations for qualifications. As of right is a term that I've said, and you've probably heard, which is a term for legislation and an initiative with the provincial government that is allowing certain healthcare professionals to move to Ontario from another jurisdiction where they already have a full license. And the design is such that the individual who is moving only has to make an application to the respective college. They do not have to be licensed, and they will be allowed to work for up to 6 months in Ontario. And this is legislation that's been around since 2023, and it applied for the last 2 years, 2+ years, to only 4 professions in Ontario: medicine, nursing, medical lab technologists, and respiratory therapists. Of late, within the last couple of months since the provincial government was elected and came back into office, there is a bill now that is going to expand that to multiple health professions. Dentistry will be included. And so that's something that we are watching very carefully. It does not apply yet, but it will likely apply before the end of the calendar year, probably sooner. And I want to first assure you that we are watching that very carefully to make sure that there are safeguards in place. And I'll tell you a little bit about some of the current safeguards and some of the risks that still continue. First of all, I mentioned that the applicant only has to apply to the college. So then they can begin to work in those 4 professions, as I mentioned. They can begin to practice. And the safeguard that's in place is that they need to be employed by a hospital or a long-term care facility or have privileges. That's something, though, that the government is going to expand. So we're watching to see how much that will be expanded. We believe there will be no restrictions on practice setting. The importance of the practice setting is that it provides a measure of oversight. If somebody is not technically registered in Ontario for 6 months, there needs to be some oversight of that individual. And so we're watching that very carefully to make sure that we understand what the oversight mechanisms will be, and also to make sure that if the college doesn't have jurisdiction, who does? So that's something that is still to be determined. There are provisions that the individual needs to attest to their good standing in the jurisdiction in which they're coming from, and they also need to demonstrate professional liability insurance coverage from day one. So there are a number of safeguards, as I said, in place, but these are things that may change in the current environment, and so we will monitor that closely. The government's also announced within this as of right construct that there will be the ability for doctors and nurses only, they're not expanding that across other professions, to arrive in Ontario from the US and to participate in the same mechanisms that I've described. So they make an application to the college of physicians and surgeons or of nurses, and they'll be able to practice for up to 6 months before they have to be licensed or registered. So again, there's no indication that that's going to extend out more broadly than doctors and nurses. I think part of the rationale is that there has been a lot of work between nurses and doctors in Canada and the United States to make sure that training and licensure processes are fairly consistent. So that's why those colleges and those professions have been working with that solution to allow for US health professionals to arrive in Ontario. I want to point you to a letter that we wrote. It's in the information section. We'll get to it later this morning or early this afternoon. We don't need to talk about it much more, but we provided a letter, RCDSO did, to the ministry expressing our concerns with some of the aspects, but also expressing support, because we are in support of breaking down barriers to licensure. And we've been doing that and participating in that way for a number of years. We are also, as I said, going to continue to sustain our very efficient and effective registration process so that we can always say that we are licensing individuals as quickly as possible. And it may also negate the need in dentistry for an as-of-right route if somebody knows that they can be licensed very quickly coming through the college. Final point that I'll make on this particular topic is that as we have more mobility and as governments across the country and various provinces are issuing new pieces of legislation, there was an article in the media about, I think it was last week, the Manitoba Nurse Regulator is starting to look at some of its own data internally to see how individuals are performing. And they have identified some concerns with the performance of individuals who are being licensed quickly in one jurisdiction and then become mobile into other provinces within the country. And I think this is something that we all want to avoid. We've seen this in years prior, but we want to avoid that there's one province that's seen as perhaps having an easier route to registration that allows the individuals then to move across the country. And so that's something, again, that we watch as RCDSO and with our colleagues on the Federation for Dental Regulators. My second topic is related to the measles outbreak. And I just want to share very quickly, very briefly, that we continue to see an increase in measles cases in Ontario, particularly in southwestern Ontario. Yesterday, the college sent a message to all dentists. We had links to resources and a message from the Chief Medical Officer of Health for Ontario. We have received notice and information over the last several months from the Chief Medical Officer of Health that's helped us to ensure that we're providing accurate and timely information to dentists. We went out at the same time yesterday morning with the College of Dental Hygienists of Ontario. We had very consistent messaging because a lot of it was obviously constructed through the CMOH's office. And the ODA last evening or late yesterday afternoon sent out a similar message with links to similar or the same resources. So we're doing a lot to make sure that we're coordinated and consistent and that we are following the evidence-based information that's arriving to us from the Chief Medical Officer of Health. So there's lots of information that's available on our website. And we can certainly direct you to that after this meeting as well. And finally, I want to just talk very briefly about governance. Governance is something that is a topic that continues to dominate regulators around the world. And I would say that probably every one of my registrar reports in the last 3 or 4 years, or at least most of them, provides an example of a governance breakdown, unfortunately. Something that's occurred either in Canada or in an international jurisdiction that is again exemplifying why it's so important that you and RCDSO continue to ensure that we have strong governance processes. And this meeting was no different. I provided you with a report that was done by a former justice, Justice O'Connor. It was a report on the Law Society of Ontario and a breakdown that occurred there within the last several months. So again, that's for your own reading. But I know that today occupies some pretty significant space on your agenda, where we will talk next about some further ways to strengthen the election-based system to RCDSO's council. And the governance committee has put in a great deal of time and energy into understanding and considering the recommendations that are coming forward to you today. So I really look forward to those discussions. I also want to say another marker of governance continue to be a prominent topic for regulators is when we look at our CNAR conference. That's the regulators conference that occurs every year in the fall. There are numerous sessions that still relate to governance and ways that regulators can continue to focus on that area and strengthen their governance processes. And I'm going to deviate a little bit from governance just to also mention that RCDSO had 3 abstracts accepted for presentations at the CNAR conference in the fall. And to put it into context, if you look at that 2-day conference, there's about 30 presentations over those 2 days, and 3 of them will have RCDSO representatives and topics. We're generally working with other colleges to provide a topic of interest, but we will talk about really improving the investigations timelines, and that will be Jill Slaughter. We'll be talking about the CPMF with other colleges and those that are looking to really build that out as a much stronger performance accountability tool. And we'll be talking about corporatization in health professions, including RCDSO, veterinary medicine, and pharmacy. So that is a great testament to the work that is being done at the RCDSO with all of our staff and all of our council and committees. And I just wanted to make sure that you were aware that we are very much trying to represent this college in a very professional and positive light. And so I want to just now close and say that we're embarking on the summer. I want to thank all of the staff who put in so much effort to making this college tick and function very well. And I just want to thank council as well for all of your incredible insights and input into all of the decisions that you've made. So Hanno, I'll turn it back to you, and I'm available to answer any questions. And hopefully that cuts a little time for further, more important discussions.
Thank you very much for that, Dan. We do have a few minutes, council, to ask questions of Dan if you would like. Ram, I see your hand is up first.
Yes, thank you. I just want to reiterate that your letter, Dan, to the ministry for the as of right rule is an excellent one. It covers all the issues that we have for registrants coming from other provinces. So I like that, and it's wonderful to inform the ministry on that. Thank you.
Thank you. Any other questions or comments for Dan? Okay, thank you. So council, we're going to move to the next item on the agenda, which is governance modernization. This begins the business section of our agenda today. And as you've reviewed the agenda, you will understand that it is a very packed agenda. And it's really important that council feel they have the opportunity to ask a question, make a comment. But on the other hand, I just want to ask for your cooperation in the light of the length and the depth of the agenda, that you keep your comments as succinct as possible. And should your question already have been answered or your comment already been made, please just indicate that and we will move on. I will be vigilant in terms of watching the time and also maintaining a speakers list. So the next item, as I said, is governance modernization. And this item is a project that came under the RCDSO's 2023 to 2025 strategic plan. At our June meeting in 2024, Council approved 3 integrated governance modernization tactics to be implemented for the 2026 election: adopting a province-wide election, reducing the number of elected council members from 12 to 10, and implementing staggered terms for council members. Council directed the Governance Committee to continue developing these concepts. This item is for your discussion and decision. The material can be found on pages 285 to 310 of your package. We have a number of votes before us in relation to this topic. We have allocated time for discussion as we go through each recommendation, and this item is scheduled to last until approximately 10:40. I would like to call on Anne Coughlin, Chair of the Governance Committee, to walk Council through this work. Anne will present a topic and recommendation. I will then facilitate discussion and present the motion for decision, and then Anne will begin to present on the next recommendation. So Anne, welcome, and I'm going to turn it over to you now, please.
Thank you very much, Hanno, and good morning, everyone. It's my pleasure to present to Council on behalf of the Governance Committee. For your consideration and decision this morning are the Governance Committee's recommendations on operational design elements for the 3 integrated governance modernization concepts that Council approved in principle last June. The Governance Committee has had robust and very collaborative discussions over the past year. We've had the benefit of a range of perspectives, including Council Dentist Dan Haas and Anthony Mayer, public members Nizar Ladak and Judy Welakovich, and external subject matter experts Anne Resnick and me. All of our voices are reflected in what you see before you today. Next slide, please. Today, I will provide you with some brief background. I'll present the recommendations associated with the province-wide election and implementing staggered terms. And finally, we'll speak about next steps. The objectives for Council's consideration today are on the slide. Staff will take away your feedback to help inform the development of relevant bylaws for Council's consideration and approval in September. I won't repeat everything in the briefing note. I will briefly summarize key points, and then, as Hanno has indicated, we'll turn it back to him to facilitate discussion and present the motion. So starting with the background. Next slide, and then next slide, please. As Council has heard frequently in previous presentations, there have been a number of drivers for governance modernization. Some of the key influencers are listed on this slide and include the guiding principles for governance at RCDSO approved by Council. Council recognizes this is the way to move forward. There has been a great deal of attention on board governance and specifically governance modernization of regulatory bodies in the past several years. We've seen examples in the regulatory community where governance has fallen short. Common issues have included conflict of interest, a culture of mistrust and dysfunction on the board, lack of transparency in decision-making, and board members lacking the necessary individual or collective skills to provide effective oversight. When the public trust and confidence is eroded in one regulator, it affects all. And sometimes as a consequence, regulators have had change imposed on them. Next slide, please. Another significant driver for RCDSO's governance work has been the current strategic plan. In September 2023, Council established the Governance Committee in bylaw. In March 2024, the Governance Committee presented to Council for discussion a high-level preliminary report about concepts that advance governance modernization. The Governance Committee then took Council's feedback, completed additional research and analysis, and in June 2024, Council approved in principle the Governance Committee's proposal to develop and implement for the 2026 general election 3 integrated modernization concepts. At that time, Council directed the Governance Committee to continue development on operationalizing the concepts. And here we are today. Next slide, please. Council approved the adoption of a province-wide election because it advances the public interest. As Council has heard before, the current geographic district elections model contributes to confusion about Council and the college's mandate. District elections exacerbate the perception that eligible and successful candidates represent the interests of the electorate, which is contrary to the fiduciary duty that every Council member has to the college's public interest mandate. The province-wide election will help reinforce that dentists elected to Council serve the public interest. Other regulators have implemented electoral reform to strengthen their competency and diversity-based selection frameworks. Greater diversity on boards leads to innovation, robust policy, and risk mitigation. Smaller boards of 10 to 12 members in total are more nimble and responsive. Maintaining 11 public members while reducing the number of elected further advances parity of professional to public members. This centers the public interest and increases public trust. Staggered terms are important because they support retention of institutional memory, continuity of strategic projects, and regulatory functions and succession planning. Next slide, please. I'll now present, I think we need to go back one, please. I'll now present the recommendations related to adopting a province-wide election. And next slide. This recommendation is that Council approve the updated competency and diversity profile for the Royal College of Dental Surgeons of Ontario Council 2025. The document referred to is detailed in Appendix B to the briefing note on pages 298 to 305 of your meeting package. Next slide, please. This slide displays the 8 units that comprise the updated profile. The profile represents the desired or aspirational composition of Council and the collective knowledge, skills, experiences, and attributes needed to achieve a Council composed of qualified members who reflect the diverse public and the communities the College serves. The profile aims to differentiate the individual skills required for the role at entry versus the desired proficiency and experience that can be developed over time in the role and achieved collectively. Competencies marked with an asterisk are prerequisites for the role at entry. It is not expected that any one Council member would possess all the competencies, but collectively, Council will strive to cultivate these skills to be effective. Next slide, please. The updated profile will replace RCDSO's current core competencies for Council members. The profile reflects competencies and attributes needed to address complex regulatory issues and opportunities, and perspectives and experience that will enhance Council's foresight and agility. Assessing the qualifications, skills, and experience of board members means considering factors beyond traditional expertise, including diverse backgrounds, perspectives, and experiences, to ensure a wider range of voices and viewpoints are represented in decision-making to effectively govern. Regional and patient population diversity remain important factors in Council composition and have been incorporated into the profile. The profile will guide the selection of Council candidates, provide the basis for the Council performance evaluation, and inform the development of Council training and education. The bylaw sets out that it is an eligibility requirement that a Council candidate has satisfied the former Eligibility Review Committee, or currently the Governance Committee, that the member has all of the competencies to be an effective member of Council as set out in a list of competencies approved by Council. Next slide, please. At this point, I will turn it over to Hanno to facilitate discussion on the recommendation and then present the motion. Over to you, Hanno.
Thank you, Anne. And Council, I would just draw your attention to the discussion questions for your consideration in your questioning or your thoughts or your comments. The questions being, does the updated profile reflect the competencies and attributes needed for Council as a whole to perform effectively? Are they understandable? There will be a companion piece to the profile that will provide further information on the purpose of the document and the competencies. Are there competencies that would benefit from further description in the accompanying document? So those are the questions that will hopefully frame your comments or your questions. And at this point in time, I'm going to look to see if there are people who have questions or comments for Anne, please. Erin.
Thank you. I just wanted to clarify where we're at on this. It was my understanding at the last meeting, our motion was to approve that you explore these and come back to us as you have today with options for what it could look like if these were implemented. But I don't think at last meeting we committed to actually implementing all of these things. Do I have that correctly?
I'm going to ask Dan to comment on that.
So I think there was definitely an exploration component to it, which the governance committee has done over the past year. And I think as as you go through the various parts of this presentation and what's coming forward to council, there will be some explanation in terms of why a particular recommendation based on all of the other options that were considered by the governance committee. And there's obviously Anne's here and other members of the governance committee are here. So I certainly think it's up to council how you want to deal with this, but in bringing things forward, I think it's important to really try to work them up as much as possible. And in this particular section, when we're talking about competencies, are there some, and I think that going back to the questions, are there things that are missing or not? Or is it reflective of what council believes are the competencies that are needed? And is it something that should be tried? And obviously these are component parts that continue to evolve. So I think, Aaron, it's a bit of what you've asked in terms of bringing back options, but also the governance committee felt that it was really important to explore a lot of the options at the committee level and bring them back and try to explain as completely as possible about what work they did.
Thanks, Dan. And it was our understanding as the governance committee that council had approved in principle that these are the three modernization concepts that council wished to move forward with. And so therefore you have recommendations on these concepts before you.
Thank you. Neil.
Good morning, and thank you for that presentation. A couple of questions just for clarification, and do let me know if this is ahead of the game. I just wanted to know is there any criteria or guiding factors in regards to diversity? One, are there any safeguards that for the number of generalists versus specialists? What if there are all the self-nominated candidates are of one class of one diversity? What happens in that situation if you don't meet the diverse pool that you're looking for? And then the second question or comment was in regards to, if I read that correctly, we are setting up a staggered system based on a scenario where the candidate with the lowest votes would have the shortest term. My concern with that is when somebody's elected to council, they come with all the rights and privileges thereof. And then by setting a precedent that you have the lower number of votes and setting you as a second-class citizen it's not a big deal, but it could be. And I'm wondering if there was another approaches in terms of asking the current council if somebody did want a shorter term or offering that out or something similar out first.
So I'm going to ask you to hold the second question. I know this is a very detailed agenda item, but we will get to that matter a little later in the presentation. I will, in terms of your first question, that does relate to the competency and attributes profile. So the way that the issue that you've raised would be addressed is that, first of all, an assessment of the current council would be undertaken to assess what is the current profile in terms of competency and attributes of the current council and where are there gaps. The governance committee will then bring back to council a recommendation of the particular competencies that the upcoming election should focus on. So if, for example, your concern was that I'm making this up, but all of the dentists who currently sit on council are specialists, then council may identify that the competency profile for the next election should include generalist practitioners. So I hope that helps with your question.
Thank you.
Thank you. Brian Smith?
Thank you. My thanks to the governance committee for all of the work that they have done to date. It's very comprehensive, wide-reaching. I think it looks at all the main points, the important points that we have to consider in making these types of changes in our governance. As a public member of council, I particularly welcome the emphasis on the public interest as being the ultimate determinant in a lot of these things. And in response to, in the interest of time, the discussion questions that were put forward for council, the three of them, I would certainly support and encourage council to adopt those competencies and attributes and so on that have been set forward. So well done, and thank you very much.
Thank you. Mark Trudell? Mark, you're muted.
My apologies, Hanno. Good morning, folks. I echo Brian's comments and accolades to the governance committee led by Anne, and thank you, Anne, for your leadership. My question is directed in terms of the council's made up of public and professional members, and I just want, for the benefit of all members of council here today and the public that is chiming in and listening, that the guiding principles apply both to public and private or and professional members. And I guess that would be clarification point number one. And number two, how the competencies that the governance committee is putting forth align with, or confirmation that they align with, the selection criteria utilized by the province in respect of nominating and advancing the names of members of the public that would sit on council. Thank you.
Anne?
Well, certainly, I think there are ongoing discussions with the ministry around public appointments, and I'll ask Dan Faulkner to comment, please.
I think the short answer to your question, Mark, is that they likely don't align at this point in terms of the due diligence and the scrutiny that we demonstrate for the professional members. And how the system works for public members. It's not to say that we don't have high caliber, high quality public members, but in terms of the system or the process to get to the end point, it's going to be very different. I think what we're seeing is several, if not many, colleges are beginning to look at their governance processes in this way for their professional members, which is building up a critical mass for us to take something to the government to see if there's a way for this to perhaps change. And that's a big challenge as well in terms of changing a system, because the public member system is not just for health regulatory colleges, it's much bigger than that. So we'll continue to work with the representatives from the government and demonstrate to them what we are doing with our professional members, and see if we can also influence some changes and differences along that pathway.
Thank you, Dan, and thank you, Anne, for the response. I appreciate the comments, and I believe it's critically important recognizing the makeup of council is roughly 50-50 in terms of public professional members. So for all the best efforts to advance competencies and qualifications. Hopefully the province is aligned with our recommendations in terms of competencies. Thank you.
Thank you. Osama.
Thank you. So I have a couple of comments. The first is, so first of all, great start with the document, and fantastic work so far. The first thing that comes to mind is the CPSO parallel, like trying to compare this or using the CPSO as a parallel may not be the best. And I kind of caution against that. And the reason is because this, I think there's something like 40,000 doctors, and being able to tap into that is much easier. I think they would have a lot more of potential applicants, and just the diversity there is a lot more. In terms of the number of dentists to tap into, I think we're at 13,000, 14,000 dentists, something like that in Ontario. So, and I think dentists are a little bit different than doctors in that, because a lot of them are business owners and they work in practices, the being able to kind of get them to, and that's why there were so many acclaimed districts in the last election, is it's very hard to get a lot of dentists who are interested in council, and that's the reality that we have to deal with. And so making it competency based, which kind of leads me to my second point, is making this competency based. I'm not sure if you are potentially, and again, just throwing this out there, potentially creating, making it even harder to bring in dentists who can contribute even in one aspect of council. And then the last thing is, I also think that, I know the districts sound like it's a negative thing, but the districts have a very positive thing too, because you want to be able to not only have a diverse group of dentists based off of their competency, but also based off of the demographics. You need to pull from Northern Ontario, and I just think, like, if you have someone who meets the competency requirements and then runs against somebody from Southern Ontario, where they know there's a dentist in every corner and they have access to more dentists, they're going to get crushed in the election. So I don't know if you're going to be selecting for dentists in the GTA and leaving dentists outside. So I don't know if these things were talked about before. I know Dan has his hand up. I'm sure they were discussed before, but I just kind of want to bring this again to the forefront, because these are the first reactions I have. Is I think we're looking at CPSO kind of as a parallel here, but I think we're very different. And I also think that, what are we going to do with those very qualified dentists up north that are in different districts that might potentially be running against someone who's, from Southern Ontario, who's also very qualified? And then, are we really creating a diverse group in terms of the board the next time around? Thank you.
Thanks, Osama. Dan? Oh, sorry. Anne, I don't want to jump over you. Do you want to answer that?
I was just going to give a very quick comment and then turn to Dan, if I may. First of all, this is an updated profile. RCDSO.
Okay, and we're having some technical difficulties hearing you.
And my second comment.
Anne, I think, can you repeat your answer, because we were having difficulty hearing you.
Can't hear me?
I am not hearing you.
Okay. Then go to Dan.
Okay.
Dan, please.
Yeah. Yeah, and just so you were cutting in and out, so we were only getting very small parts of what you were saying, and I'm not sure if you'll have a fix for that. But I think what Anne was going to say is that from the competency perspective, which is the unit that we're talking about right now, This is just building on what we're already doing. And in fact, the competency-based approach with defined competencies has been around since I started. So a lot of it was developed before I started back in August 2020. So really, this is just trying to look at an evolution of that and to step back after 4 years and say, are we capturing the right competencies? And as Anne said, it's not that every member has to come with all of them. It's that we want to create a collective, including public members, where that is possible to evaluate that, where we are representing those various skills and competencies on the board, on the council as a whole. I want to also just comment on a couple of other things, Osama, very quickly. First of all, we're not using CPSO as a model. We are using CPSO because they've just introduced a provincial election system, and the College of Pharmacists introduced one, I think, a couple of years ago as well. And so we're looking to learn from how that works. We're looking to better understand, what are the hills and valleys of doing a provincial election system. And because they've most recently introduced it and had their first provincial election, that's what we're comparing it to. We're not comparing everything else to the CPSO system, just to be really clear about that part. And then this is going to be talked about further. And I think this is always the danger of a big topic like this, where there's multiple parts, that we are going to get to some of these parts, because I know last June, the conversation really did also reflect how we're going to make sure that we have proper representation. And the committee, the governance committee, spent a lot of time thinking about protected seats, but decided to recommend a model that looked at what you've heard a little bit about, and we'll hear more about, where there's this ability to look at where we have gaps. And remember, this is not an election of 10 people every year. This is or every 2 years. This is an election every year that's 3 or 4 people. So we're able to always be looking at the evolution of council and filling in those gaps by looking at the profile of who do we need. So again, Anne's going to talk a lot more about this, but I totally appreciate your question about making sure that we do have representation and don't create unintended consequences of restricting people that might not get the votes by virtue of where they live or what region they practice in.
Okay, thank you, Dan. And I'm just going to check in with you so you can hear us. Is Anne frozen again? Okay.
I think she's frozen.
Can you hear me?
We
Can you hear me?
You, Anne.
My camera off, if that's all right. I think it's weather related, but I'm having Wi-Fi issues. That's all right?
Yes, we can hear you. So continue, please.
All right. So there, I see some other hands. Hanno, did you want to take those before I?
Sure. So, okay. So I've got Lara and then Neil, please. Lara?
Thank you. Sorry, I just wanted to add to sort of what Dan had just said. The governance committee did take a look at other profiles of other regulators, boards, as well as profiles for the broader public service sector. So I think, the example that we included in the council package of the CPSO calls for expressions of interest was just to give you an idea of how that candidate profile would look, to give council an understanding of how the board would take a look at the gap analysis from the current council, as Anne described. Look at the governance committee's recommendations about, what competencies or attributes are needed to sort of enhance the capacity of council. And then council would be given an opportunity to provide input on that call for nominations prior to the next election. So, I just wanted to emphasize that, the committee did look at other regulators' profiles. As Anne was saying, This is an update to the current competency profile. All colleges are required to look at board competencies. That's underscored in CPMF. We do have a current eligibility requirement that council candidates demonstrate or satisfy the governance committee that they have the competencies needed to perform effectively in role. So what we've done here is just sort of beef up the current document to ensure that it reflects what's needed in the next 10 years to address those really complex issues that the board will be looking at.
Thanks for that, Lara. And Neil, you're next on my list.
Thank you. Sorry, thank you so much. Competencies, I got full clarification on. Just wanted a little bit more clarification on the equity, diversity, and inclusion portion. Just a rough example, what would happen if you had a slate of a majority of South Asian women, for instance? Is there a protocol and how to handle that? Is there some guiding principles or I don't know, just some clarification on a situation like that?
Anne, can I turn it over to you? Or do you want me to go to Lara?
Thank you. The governance committee would look at that item and then look at the competency and attributes profile and propose to council a way to address that in the selected competencies that would go forward for the next election. So there is that check and balance with the governance committee doing its work and making recommendations to council, and council having an opportunity to then confirm what competencies would go forward for the upcoming election.
Thank you. Nalan.
Yep, thanks for the presentation. Two questions. Number one, with the new structure, do you anticipate the college having trouble trying to attract professional members to even run? And two, I know in the future, one of the aims of the college is outreach to the profession for collaborative purposes. Now that we have district representatives, if they do indeed follow their mandate of protecting the public, the second thing they do is they help in that outreach. We now have outreach to many districts and many component societies in the province. So do you think there'll be a problem when we lose that?
The governance committee has had some discussion, and it is on a future agenda. We identified that a robust communication approach will need to be used with all members to introduce the implementation of governance these three components of governance modernization. So we would that a very different approach to outreach, and that is something that we will have on our upcoming agendas and will report back to council on in future meetings.
Thank you. Anthony Mayer.
Thank you. I just wanted to comment on Neil's question in that as a member of the committee, we had like a lot of thorough discussion about this diversity issue. And there's the objective here is to expand the whole issue of diversity away from the more obvious ones of gender, ethnicity, and location. Because in your exact example, Neil, those three South Asian ladies could still have completely different attributes in terms of one being a specialist, one being a generalist, one having a lot of experience working with Indigenous people, and all these. It's a much bigger file, and that's what ultimately, I guess, council's going to have to trust the governance committee that we're doing our due diligence on this issue, and we're really taking it to a much more complete level than what exists currently, which is really just geographic diversity. Thank you.
Thanks, Anthony. Lara.
Thank you. I think I just wanted to, first of all, respond to Nalan's question with respect to whether we'll have trouble finding candidates to run in the election. I think what we've seen is historically, there's been a pattern of acclamations, a number of acclamations, I think, in some districts. And I think the thinking is that some of that can be attributed to the current geographic electoral system model. It can be intimidating for candidates to run up against high caliber competitors in their district. So the province-wide election will address that issue, and we hope to see increased interest in running, and that it will address the sort of interest issue. And just to build on Anthony Mayor's comment a moment ago, we have started conducting demographic data analysis on council and committees. We're already issuing equity statements in our calls for expressions of interest. Now what we're doing is moving to a more data-informed approach to take that analysis of potential gaps on council and build that into the profile for the upcoming election. And that, of course, will be ratified by council before the call goes out.
Thank you. I have Osama and Neil on my list before we entertain the first motion. So Osama, I'm going to turn it over to you and then to Neil, please.
I'm going to be quick. I love the Anthony. I usually agree with you, but this seem, and I'd love to hear what Peter and Daniel, like Robin, what you guys think, because you guys are up in rural, kind of more rural communities, but it doesn't make a lot of sense that you're gonna have somebody running from up north, and yeah, they might be running against some high caliber person in their local district, but if you run in Ontario, you're gonna be running against a bunch of people from all over the province. So it's going to be much more intimidating for those dentists or professional members trying to run. I think I think I can humbly say this. Like, what are the priority factors? Like, yes, okay, let's say you have three people of the same skin color who are, who might have very different, one's a specialist, but what are the real factors? I think actually demographics and location is a huge factor. And it may seem like it's limited, but I think it should be high on the list in terms of what are, I would actually consider it just as important as a competency. If I dare to be that, and so I think there's got to be a little bit more, and I'm sorry if I'm stepping on anybody's toes, but I think there has to be a little bit more thought in this. And I know we're not making any like big decisions today, but I think, and I'm monologuing here real quick, but like, what is the objective of this? Are we trying to get the best board possible? Well, what is the best board? The board is going to be based off of competencies, but there's also other variables that are not just competencies. There's going to be ability to relate to people in the communities. And I think we're going to lose some of that. And we might be going down a road where we have a full board of just people from Toronto and Mississauga and Oakville and Hamilton, and we may be losing out on some of that. So that's my worry.
Okay, I'm going to jump first to Dan, then to Lara, and then I'm going to continue my speakers list. So Dan Faulkner, please.
Yeah, and Osama, there's been a lot of discussion at the governance committee about that. I mean, that was loud and clear at the June meeting last year, that we couldn't have a council that was stacked with just big city dentists. And we believe, the governance committee believes that this system will address that. So I'm going to make a couple of suggestions. First of all, I have looked at the minute and the motion from last year, and it was to direct the further development of adopting a province-wide election. So I think we have to be really true to council and the fact that council did pass this motion. So we can deal with all the questions and the concerns and how we're going to make sure that those issues that relate to districts and the relationships are managed and dealt with. But I just want to be true to motions that have come forward from this council as well. The second thing is, and I'll eat crow on this because I suggested we go through and try to do motions as we go along. I'm just wondering if it makes sense for the whole presentation to be done. And then we can come back to the motions, because a lot of what's being asked and a lot of the concerns that are being expressed right now, we may be able to address some of them as we go through the presentation. Maybe not all, but maybe some or most of them. And I think that might be a way that we can deviate. But I'll turn it back to the chair to sort of help us manage through this. But I think that will help us to make some forward progress on this.
Okay, thank you. So I do still have a speakers list. What I'm prepared to do, Dan, is I think your suggestion makes perfect sense. I will keep that speakers list intact. If we then maybe turn it over to you, and because we still have 4 items that we need motions on, one is going to be an information item. So if your hand was up, your name is on my list. So I'm going to suggest we follow Dan's suggestion in that, and I'm going to turn it back over to you. Walk us through all the other areas. Then we will go back to the individual motions, hopefully with enough clarification, but I will then first return to the speakers list that I have. So Anne, I'm going to turn it over to you now, please, to go on with the next item.
If you can't hear me.
Yes, we can.
Thank you. Slide 13, please. So the second recommendation before is that council approve the proposed enhancements to the current council candidate selection process. And those amendments are described in the briefing note and illustrated on the next slide. Next slide, please. As I indicated earlier, the proposed enhancements are to a process already in place. All council candidates for the past 2 council candidate council and selection cycles have undergone competency assessment reviews, whether the former eligibility review committee or the governance committee. Each year in advance of the election, council will assess itself against the profile skills and attributes to identify whether and where gaps may exist. The governance committee will review elective results, conduct an analysis, and use the analysis to develop a proposed candidate profile and call for nominations that highlights the competencies and attributes that RCDSO is looking in the next election. The governance committee will present the analysis and council's feedback.
Okay, and we're losing you again. And we're losing you again.
Will be incorporated.
You write all this down.
I'm wondering, Hanno, it's Dan.
Yes.
Again, it's *6.
I'm wondering if maybe Laura can continue with the presentation. I think we're losing Anne in too many places.
Okay, I agree.
Okay. The governance committee will present the analysis and proposed candidate profile to council for ratification and for council's feedback. And that feedback will be incorporated into the profile for the upcoming election. The college will issue a call for nominations to registrants that articulates the number of vacant election seats, the candidate profile, and links to the application package and online orientation module. As with the current process, all candidates interested in running will be required to meet the eligibility requirements, submit an application form, and complete the mandatory orientation module. Staff will screen application packages for completion and initial bylaw eligibility requirements such as conduct. And this process is already in place. The governance committee will interview and screen applicants against the profile prerequisites, and these competencies and attributes that have been ratified by council will be used to select candidates to appear on the election ballot. So I think that this will address some of the questions that we just heard from council. For example, if the gap analysis revealed that important regional perspectives, rural, remote, small to medium communities were missing in the current council complement, the candidate profile or call for nominations for that election would stipulate selection for candidates that bring those perspectives. Next slide, please. The rationale for the enhancements is on the slide. Enhancing the current council candidate selection process will achieve council competency and diversity in a province-wide election by enabling prioritization and selection of candidates that have the skills and perspectives that will enhance council capacity. This approach also reflects council's commitment to EDI as expressed in the guiding principles for governance at RCDSO, and more broadly in RCDSO's Equity, Diversity, and Inclusion Commitment Statement that Council approved last September. Strengthening the current council candidate selection process will address council's concerns we heard last June regarding the need to maintain regional diversity and will ensure that any gaps on council are prioritized and selected for in the candidate selection process. Next slide, please. We had some discussion questions, but we'll defer those until the end.
Thank you.
And Laura, I am back. My apologies. I've moved, and I think that I can take over if that's all right.
Thanks, Anne.
So I'll now briefly update council on an information item related to the province-wide election. Council will not be asked to render a decision on this issue today. The Governance Committee has had discussion regarding different electoral models and is exploring an alternative to RCDSO's current plurality electoral system. The Governance Committee will provide Council with more information on this topic at the September Council meeting. Historically, voter turnout at RCDSO's general election has been low. The Governance Committee is interested in exploring another option that may enhance engagement and strengthen the electorate's confidence in and support for Council. The Governance Committee will be reviewing further research and analysis on this topic over the summer and will bring information to Council in September. Hano, do you want to have discussion on this now, or do you want me to keep moving?
I think, Anne, we should keep moving. And then once you're totally finished, we'll go back and revisit either each motion or each discussion item and then take questions.
Perfect. Thank you. I'll now turn to the recommendations pertaining to implementing staggered terms for council members. The third recommendation before council today concerns changes to the term of office and term limit provisions for both elected and selected council members. The proposed revisions to the terms and term limits are described in the briefing note on page 292 of your meeting package and are summarized on the slide. Next slide, please. The rationale for adopting a 3-year term of office and 3 consecutive term limits are captured on this slide. The Governance Committee had extensive discussions on each issue. The shift to a 3-year term brings us in alignment with other health regulators. Extending the term requires amending the term limit provisions. This is why we presented the proposed amendments as a package. Most importantly, the proposed changes are intended to enable new board members to grow into the role, strengthen confidence, and enable the college to continue to benefit from the wisdom and experience of council. And now we will go to, I'm just moving, recommendation number 4, which would be slide 23. Council is asked to consider and approve a 3-year cooling off period for elected and selected council members who have served the term limit. The rationale for the proposed change is summarized on this slide. A 3-year cooling off period would represent a slight change to RCDSO's current provision and aligns with other Ontario health regulators. The Governance Committee agreed that the cooling off period should be the same for elected and academic council members, and that provisions should clarify that an elected council member who has served the term limit must serve the cooling off period prior to being eligible to serve as a selected academic council member, and vice versa. And now moving to recommendation number 5, which is at page 26, thank you. The final recommendation before council concerns the proposed model for implementing staggered terms for council members at the December 2026 election. The provisions are outlined in the briefing note and the slide before you. In essence, they entail extending the terms of the 3 incumbent executive committee elected dentists by 1 year and designating the remaining 7 elected council member seats as open for the province-wide election. The 7 successfully elected council members would be assigned 1 to 3-year terms based on the number of votes received. Next slide, please. This slide provides council with a visual representation of the proposed implementation model. There will be a smaller number of elections, 3 or 4 each December. Elections will be held for those seats for which the terms of office are ending. Some governance resources suggest a general guideline for board turnover is to replace no more than 1/3 of the board members annually. 1/3 turnover allows for a blend of new perspectives with experienced members, creating a more diverse and balanced board election each year. Next slide, please. Implementing staggered terms will bring RCDSO in alignment with other Ontario health regulators. Staggered terms enhance board continuity and stability in composition, which helps retain understanding of the board's decision-making processes and institutional knowledge. They prevent a sudden significant turnover, which can disrupt strategic planning and implementation and operations. They support effective transitions of leadership and succession planning and ensure a balance of experience and new perspectives on council. Next slide, please. During the transition, it will be important to adopt a model that balances new perspectives with the wisdom of existing council members by extending a certain number of incumbent council members' terms. This approach will provide the greatest stability, knowledge retention, and business continuity of the options that the Governance Committee considered. It will also avoid significant turnover at the 2026 election. At a time of transition, the college is well served with the wisdom and experience of all 3 incumbent executive committee elected dentists continuing on council for an additional year. The current executive committee elected dentists have demonstrated their fiduciary duties to the college, have expertise and an in-depth understanding of certain issues, which will be important for enabling the business of the college to continue. The proposed model for implementing staggered terms for RCDSO council members depends on the current executive committee elected dentist's ability and willingness to continue serving an extended 1-year term on council. And that brings me to the end of presenting each of the recommendations from the governance committee.
So thank you for that, Anne, and thank you, Lara. Thank you as well, Council, for your patience and your flexibility in terms of the technical issues that we were having. So now that we have that information, Harinder, did you?
Yes. I just want to make 2 points. One is that a lot of interest and concern have been expressed about geographic representation. And I think after listening to the whole presentation, probably that members can be satisfied that because these elections are staggered and there will be only sometime 3 or 4 members will be contesting the election. If I'm not wrong, the first 7 elections are just because of the introduction of this provincial-wide election, and then every year it won't be the 7; it will be some 3 or 4, whatever number is designated. The other thing I want to make a point is that council has already committed to the governance committee to do what they're doing. And I think they have done a great job at bringing this forward. So let's get behind this and see how it is going to work. My feeling is that they have put a lot of work, they have considered everything, and as Lara has explained some of the things, Anne has, we will be looking after all those concerns which have been expressed within what governance committee has presented. Thank you.
Thank you. So what I have, the speakers list that I already had based on when we made our switch, I've added the people who put their hand up here. So what I'm going to suggest that we do now is we go back to the beginning and look at the motions in the order in which they were presented. So what I would ask, if we could please have motion number 2 on the screen, which is that council approves the updated competency and diversity profile for the RCDSO Council 2025 as presented. I'm going to ask for a mover and a seconder for that, and then we're going to go to the list that I had left over. So the mover for that motion is going to be Jamie Colliver, seconded by Mark Trudell. And now I'm going to go back to the speakers list that I had told.
Yes? I don't think Jamie's moving that. I think everyone should put their hands down and start the motion again.
Okay. So Ram, could you put your hand down, please? Okay. So the motion that I'm going to ask for a mover and a seconder on is that council approves the updated competency and diversity profile for the RCDSO Council 2025 as presented. That's moved by Mark, seconded by Ellie. And now I'm going to go, so you can put your hands down because I do have a speakers list that I said I would honor. So the first person on that speakers list that I had originally kept was Robin.
Hi, everyone. Thank you to everyone for all your work on these committees and all of the discussions and everything that takes place to get to this point. I guess I'd start by saying I appreciate Osama's comments and he shares my concerns. Again, as he said, coming from a smaller rural area, I just feel that demographics is high on the priority to have a fully functional council with a lot of different viewpoints. When you don't live in this area, you can't even appreciate or assume some of the differences in practicing here, or even more remote than me by far, where we even have building code restrictions and other things that you just don't even face in the city. With practice size and things like that, there's lots of considerations. And if you're really talking about our concerns in most recent years with access issues, and again, just if we're really representing the public and public's concerns, then we need to demographically consider that heavily. Everything is different here than in the city. And I guess, yeah, my other comment just quickly would be that I think when we approve these motions starting and say that, yes, we should look at these issues and have a committee to assess and reassess and reconsider how this is done, that yes, we agree it's good to look at it and update it. And explore some different ways of doing things. But then it's also okay to have this discussion and to listen to everybody and backtrack and say, you know what, most of it was working, or, you know, historically, most elections on many different things are demographic, even political, and it's always worked. So sometimes it's good to assess something, but then listen to what people are saying and then say, you know what, it doesn't mean just because we're assessing and spending the time, and it's not that it wasn't worth doing the work, but you can also go back and say most or part of this was working fine, and maybe we'll keep some things the way they were. So just because we say it's okay to discuss an issue doesn't mean that the ending has to change.
Thanks, Robin. Daniel Fortino.
Thanks, Hannah. I appreciate everything. It was a great discussion so far. Just a few comments and one question. Just to reiterate Osama and Robin, I don't want to keep mentioning this, but definitely being in the northern area of Ontario, I think the focus on any council really should have a balanced decision-making council. I think that's important. We want to prevent that urban bias because especially in policy making or making decisions as part of the council, local insights of firsthand experience is vital. I think is vital to any decisions that we make. So I just want to reiterate that, and I'm not sure how we're going to capture that in the council. So that's sort of my question. I haven't really heard of any specifics, if we'll get to it, of how we will actually capture a balanced representation and avoid sort of any biases, especially a centralized bias such as an urban bias. So those are my comments. That's my question. I'm not sure if that could be answered or if there's any specifics that could answer that.
Okay, thanks, Daniel. I'll go to Lara or to Anne to respond to that, and then I'll go back to my speakers list.
Great, thank you. That is a topic that the Governance Committee spent a considerable amount of time discussing. And I want to assure Council that the recommendation that is before you is a result of conversations around how can we best ensure that broad diversity on Council, including mitigating against a urban perspective. So for example, if Council does its assessment prior to an election cycle and determines that for some reason, maybe it's incumbents' terms being up or whatever, the Council is made up of all urban dentists, then the competency profile and the call for nominations for the upcoming election would stipulate that the college is looking for dentists who bring a rural, remote, whatever Council identifies is a current gap. So that is how the Governance Committee is proposing to ensure that there is an opportunity for those broad perspectives at Council.
Thank you, Anne.
Lara?
Thanks. And just to build on what Anne said, you know, what we're talking about now is updating the current profile for council members rather than the selection process, which perhaps we can have a bit more discussion at when we're talking about motion number 3. The current profile does not get into diversity, and I don't think it stipulates regional diversity. That council be comprised of you know, various demographics, including regional diversity. The Governance Committee heard council's concerns about the importance of regional diversity, and that is why regional diversity and patient population perspectives have been built into the updated profile. And as Anna has explained, the idea is that an analysis will be conducted on the current complement of council if it is found that certain regional perspectives are missing. The next call for elections would stipulate that candidates bring those perspectives. So it is providing some reassurance that regional diversity will be considered and selected for in the upcoming election. And the governance committee in the next recommendation will explain how council will ratify that call for nominations.
Thanks, Lara. Iliad.
My only concern was with the changes with the Ontario voting system, the person who gets the least amount of votes, it gets only 1 year of term. I'm just wondering if that 1 year is sufficient enough to get to even understand how the college functions. I'm just wondering why that is that we decided to do that.
Ilya, could we suggest that we sort of table that until we get to the staggered terms? And would that be appropriate to deal with the question there?
Thank you.
Okay, so Iliad, I'm going to come back to you when we get to that section of our consideration, okay? Peter Deline.
Thank you, Hanno. A couple of comments I wanted to make. Number one, I'm a great fan of staggered terms. I'm a great fan of the 3-year term as well. And I wanted to speak a little bit about Northern Ontario. I'll be honest, I've been here, it's my 4th term. There have been very few Northern specific items that have been brought up, I'd say, over the last 8 years. Perhaps the most important one was, perhaps for me anyway, was the French language issue. And not just in Northern Ontario, but also down the east side of Ontario. The other one that's big in Northern Ontario is access to care. And that seems to be universal. There are roughly, in the last election, there are about 350 dentists north of where I live. So from North Bay to Manitoba, there aren't a whole lot of dentists. So I have one recommendation when it comes to election time. And that's, when the committee has filtered down candidates from a list of applicants, I think it'd be a good idea if we didn't list where each applicant, in their candidate statement, let's not list where they're working and just kind of level out the playing field that way. They're an Ontario dentist, whether they work in Sudbury, whether they work in Toronto, downtown Toronto. 99% of the dentists who read the candidate statements won't bother Googling where that person's from. And I think that helps to kind of level out the playing field. If it becomes a GTA, people who list themselves as working in Toronto, the 350 dentists in Northern Ontario, I can say probably work within a 2 to 4 block section of downtown Toronto. There'd be a minimum of 350. There's probably 650 dentists in a 2 to 4 block section of downtown Toronto. So that's the idea I want to bring.
Thank you. Jamie Colliver.
Yes, thank you. Appreciate all the presentation and the comments for sure. I just wonder about the vetting process, the submission of applications, and then the vetting that will go on. This is question number one, and could be answered at the end of my second question, and that is, Do you feel that the vetting process has the opportunity to eliminate people because of the process? Has it been tested in other areas with regard to this particular system? That's number one. And I know we've referred to the elections and we referred to professionals. So my question number two is, in all the process at looking at competencies and skills and all those sorts of things, and this follows along with Mark Trudell's question or comment earlier on, where in all of this will there be a discussion, an ongoing discussion with the Public Appointments Secretariat to ensure that public members are identified appropriately? And, you know, who is going to have those conversations with the, as I said, the Public Appointments Secretariat? We haven't really referred to this at all in any of this modernization. And frankly, there's a requirement even at the Public Appointments Secretariat for modernization efforts. It's ongoing in other agencies of the government. So is there a roadmap for that? So vetting, turning professionals off, number one, and second of all, the Public Appointments Secretariat and conversations with them. Thanks very much.
Thank you. Anne, can I turn that over to you?
Thank you. In terms of the process for screening candidates, that has been ongoing for several years, starting with the Eligibility Review Committee and then with the Governance Committee. And I can say, having sat on both committees, that we have identified individuals who do not meet the competency profile. So what we are going to be working on with the new and enhanced profile is to look at our process for calling for nominations, candidates, and then our process for selection. And that process will, as it has been in the past, will be based on the competencies that Council has highlighted as critical to this particular election. So the selection process is competency-based. It is an in-person interview, which follows the submission by the candidate of a written response to the college's competency profile, which comes in the form of a set of questions, sometimes scenarios. I hope that helps give you a sense of the process. Thank you. In terms of the public, as Dan mentioned earlier, the college's mandate obviously is around the election of dentists. And I would expect, as I know has been the case in the past, that whenever colleges make changes to their processes in relation to elected members, that those best practices are shared with the Public Appointments Secretariat. So that is one strategy that I think the Governance Committee would certainly recommend. And I will ask Dan if he has anything he wants to add in terms of that.
Only to say that, Jamie, like the short answer to your question is we haven't fully examined that part of governance with public members. And that, to Anne's point, it is something that we are always sharing as colleges in Ontario, health colleges change their practices. They do share that broadly. And I do think that there is some strength in numbers. And this is a live issue at our HPRO meeting, our federation. So it is something that we will continue to look at how we can influence any changes, if that's possible, with the Public Appointments Secretariat. It is a very different approach than what we're talking about today. So it is something that we will have to look at a little bit separately and strategically as well.
Thank you. Aaron, you were next on my speakers list, but I see that your hand is down. So I'm just going to check in with you to make sure that you don't have a question, or if you do, it's already been answered. You're good. Okay, thank you. Neil, you're next.
Thank you. Regarding the governance committee or selection or vetting committee, I would assume that that committee would not comprise anybody from this council, that it would be potentially an external body, because you are ultimately determining the people that are going to be running against you, as opposed to the districts. And I get there's a staggered term, so you could technically pick people that are not contesting the election during that term. But people do know each other, and sometimes those perceived conflicts do exist. So I just wanted to see what that process was.
So currently, the governance committee meets in panels to review candidates, and we always look at conflicts of interest in advance. So with a new process and a province-wide election, that is something that we would certainly address in our refined process.
Thank you.
Thank you. Osama.
This will be my last comment because I keep coming back to this. But so I just want to say again, you guys did an amazing job with this. This is not, we're being overly kind of critical here because this is such an important decision. And I think, at least for me, I would feel comfortable really understanding where the gap analysis is and knowing what criteria there's going to be for that gap analysis, like some sort of framework, and where the priorities are going to be in that gap analysis. So there's a lot of words that are being mentioned today, like competency, then there's demographics, and then, oh, we'll take a look at where the gaps are in the board and then make a decision in terms of how we're going to but if there's conflicting priorities in that gap analysis, how is that going to be made? So I think there needs to be a little bit more homework done on that gap analysis. What information are we really trying to gather? And that's going to at least help us and help this governance committee in terms of where are the priorities, I guess, is what where I'm getting at, right? Because if there's, let's say there's, just to use an example, let's say there's competing priorities in terms of the gap analysis. What takes precedent, and what is the criteria or framework that is being used for that? So I think there needs to be a little bit of a deeper dive in that gap analysis, and I don't know if I'd be comfortable approving this without knowing a little bit more detail around what the framework would look like. Not to put more homework for everybody here, but I think there needs to be a little bit more information with regards to that. Thank you. And that's my,
Thank
I'm
you.
done now.
Thank you. I think that is the challenge with this work. And the gap analysis will be based on the updated competency and diversity profile. So that is why we're bringing to you today that updated profile for council's approval. And then we will move forward with developing the gap analysis that will come to council. So it will be council who has the discussion around what your questions are great. That's the kind of discussion that will happen at council in terms of where do we need to move with the profile and call for nominations for the upcoming election.
Thank you. Dan.
Yeah, thank you to everyone for questions. And I think on that point as well, the gap analysis will evolve. So like it's going to change with council members, obviously. And I liken this to the policy and standards process that we have, where most of the work happens outside of council, but council has the ultimate authority to make decisions. And in this case, it would be on what are the gaps that we're seeing? Why, governance committee, are you coming forward to us at this point saying that these are the gaps based on that data? And I think that framework that you talked about, the gap analysis on an ongoing cyclical basis, is an implementation piece of this, which will absolutely happen. But we have to have some of these, I think, foundational pieces in place in order to do that. But I would say to you, Osama, and all of council, that those are elements that will absolutely be developed, and council will have the ability to say yes or no to what the gaps are in order to conduct whatever the upcoming election cycle is.
Thanks, Dan. Anthony Mayer.
Thank you. Thank you, Hannah. I just want to maybe offer some commentary and perspective here in that, just the current system that we're operating under, notwithstanding the governance committee doing a bit of analysis of candidates, really is no longer modern and supported by established knowledge about how the best boards run. And I don't think any of us here would actually vote in clear conscience, or most of us would not, for the current system, because it is no longer adequate. We know so much more about how boards work. And the current system has a significant luck of the draw element that has on occasion caused dysfunctional boards. Luckily for us, we're not one of those boards. But the efforts that we've made at the governance committee are to try and mitigate that risk significantly to give us the best chance going forward. Thank you.
Thanks. Anthony Lisho.
Thank you, Hannah. I just wanted to point out that I'm a prime example of this, let's call it new system, because it has been in existence for a while. The district that I represent had no representation even after it was called for interest, and that's why I came on board in March as opposed to January, and it was for me it was an onerous process, having done the course, or the I think 30 or 40 questions that I answered, followed by a number of other interesting scenarios that I had to comment on, and also a 3-panel interview from 3 different colleges. So as onerous as that might have been, it imparted that I'm really interested in doing this. Otherwise, I wouldn't have gone through the process. And having done that, I think they drew on my experience, the fact that I had done dentistry in different parts of Northern Ontario, as well as in Nunavut. Talking about licensure, we talked about that before. It was very easy for me to get a license in Nunavut. So that's another aspect. But the system already works. And I think this step that we're at now is to make it even more efficient and to streamline it so we could make it even better than when I came on board. Thank you.
Thank you. Aaron.
I guess I'll say, I see a lot of potential in this system to definitely go beyond whoever gets the most votes, and to make it based on competencies and what's needed, rather than just a popularity contest. And I think it also leaves space for people who you may have multiple candidates in the same district who are running against one another, who would all be really great for the job. But if it's geographically based, you can only choose one, whereas this gives a little bit more flexibility. Having said that, I don't know if I'm quite there and ready to give blanket approval just yet, because I do share a lot of the concerns that have come up already. And I think there's a lot of what ifs that we still want to flesh out a little bit more. And I think I will get there, because you're never going to come up with a perfect system. There's always going to be questions. There's always going to be unknowns. There's always going to be things that may not work as we'd hoped or planned that we have to tweak as we go along. But I'm personally, I'm not sure I'm ready to give full support to this yet to date, but I'm undecided, to be honest.
Thank you. Brian Smith. Brian, you're muted.
Sorry about that. It's interesting what we've been discussing here. And we boil it down, in my opinion, slide 28, which talks about the impetus for change, slide 29 of the proposed model and the benefits of that. The competency profile is evolving, and I think it's, as Anthony mentioned in his previous comments, I think it'll never be a perfect system, but it's one that we always have to pay attention to, and always we'll be reflecting on changes that are brought about. And I want to thank again the governance committee and members for all their work. But let's go forward with this, recognizing it's not a perfect document or perfect process, but we'll learn as we go and serve the public interest going forward, as well as the governance or members' business. So well done again to everybody involved, and I hope we can approve this today as a first step in going forward. Thank you.
Thank you. Last speaker is Jamie Colliver, and then I'm going to take a vote.
All right, thank you, Hanno. Osama, thank you very much for pointing out the gap analysis and how important that is. And Dan, to you for the evolving aspect of the gap analysis. I think when you start talking about ongoing changes and looking at gaps, we have to ensure, or anybody has to ensure, that these are achievable gaps. In other words, you have a list of candidates and you put out a call for someone with a certain particular talent. You have to make sure you have a good base of candidates potentially. In other words, have it a realistic, achievable gap. Okay, that was my real question about the vetting aspect and how it evolves. And then last part, will the gap analysis apply to the public members? I assume that they would. I know we're not talking about that right now, but if someone could, public members will also have to pony up on a lot of the issues. And again, those discussions I know are going to start or are ongoing, but I'd like to be assured that the public will see those gaps. Thank you.
One piece, Jamie, that I will add is that when council conducts the gap analysis, public members will be involved, because we're looking at the full composition of the current council and where the gaps may be. So I just wanted to make sure that was clear.
Okay, thank you. So I'm going to ask that motion number 2 please be put back onto the screen. It's been moved and it's been seconded. This motion requires a simple majority. There are 22 council members who are eligible to vote. And that motion is that council approves the updated competency and diversity profile for the RCDSO Council 2025 as presented. And now I would ask you to indicate your approval if that's where you're going. So I have 17 in favor. If you would lower your hands, please. Those opposed? Four opposed, and then one must be an abstention. So that motion is carried. It is 10:30. We've only given this item another 10 minutes. I don't want to cut off conversation, but I think what we will have to do again, please just keep in mind to keep your comments as brief as possible. So the next motion for council's consideration is motion number 3. that council approves the proposed enhancements to the current council candidate selection process as presented. And if I could have moved by Anthony Lisho, seconded by Mark Trudell. Any questions or discussion on this motion? So please put your hand down now, because I do want to give people the opportunity should they have a question. Okay, I'm seeing none. In that case, please, those in favor, please raise your virtual hand. And again, this is just a simple majority required. Okay, so I see 15 in favor. Lower your hands, please. Could those opposed please raise their hand? I see 3 opposed. The rest must be abstentions. That motion carries. The next item was on the electoral system, rather. That was just for discussion. So again, I will give you a brief opportunity if there are questions you wish to ask of Anne based on that. Okay. Oh, Anthony Mayer.
Thank you. I just wanted actually to respond to Iliad's question earlier, which I think most of the membership have that concern about the 7th highest number of votes getting only 1 year. There's a couple different things related to that. I don't think any of us really love that, but it's a kind of a arithmetic issue in that we decided at the committee that it was far more important, given that we were going to get into a whole new system, that we protect the institutional knowledge on the executive, and there are 3 dentists on the executive. So that meant that we had to only elect 7. And then because of the 3-year terms and the rotation of the 3-year terms, when you work out the math, this happens only once in the whole system, forever and ever going forward. It'll never happen again. And so potentially it could be somebody new who's only there for a year, but that person could clearly run again. But Iliad, you should also consider it could be somebody who's already done 2 or 3 terms, and then they just have 1 extra term. So it's not perfect, but when we compared it to multiple other systems, we sort of felt like it was most important to protect the institutional knowledge at the executive. Thank you.
Thank you for that, Anthony Mayer. Iliad, I'm going to come to you in a moment because you had that designated position on my speakers list. I just want to check quickly if this is part of the item for which Harinder and Aaron have declared a conflict of interest, or if it's an item later on. So Harinder, are you and Aaron in conflict for the staggered terms council members term of office?
Yes.
Limit?
Yeah. We should be excluded from.
Sorry, I'm in conflict as well.
Yeah, so 3 of us should be excluded from the discussion.
Okay, so then what I'm going to ask Angelo, I think our understanding is Angelo will place Harinder, Aaron, and Nalin into a breakout room, and they will be brought back into council meeting once we've dealt with this section.
Hannah, I'm sorry, can I ask a question? It's Laura.
Yes.
My understanding was it was just the conflict was with respect to the recommendation number 5, not the term and term of office and the cooling off period. It was just with respect to implementing staggered terms.
Okay, so for the last motion that we're considering, not for this one.
Correct.
Okay, Dan, I'm going to ask you for clarification on that, because if that's the case, we can bring those 3 back for this.
Yeah, I think that's true. I mean, let's put the motion up on the screen. If we're talking about the one that relates to 3+3, 3-year term of office for 3 consecutive terms,
Yes.
Then that is not a conflict for Nalan, Aaron, or Harinder.
Okay, so that is in fact the motion we are considering now. So in that case, Angelo, sorry to do this to you, if you could bring those 3 back into the council room, and we will sort of send them back to the breakout room when we entertain another motion further on down.
Thanks, Hannah. They're back in the room.
Thank you so much, Angelo. So council, this is the next motion for your consideration, that council approves the 3-year term of office and 3 consecutive term limit, i.e. 9 consecutive years, provisions for elected and selected council members as described in the briefing note. So I'm going to take that off the screen now. That's moved by Anthony Lisho, seconded by Ram. But before I take the vote, Iliad, is this an item you wanted to speak to, or you wanted to speak to the last one that we're doing, correct?
Just the last one, but my question got answered.
Okay, perfect. So in that case, that motion is on the table. So we have 22 people. Again, this is a simple majority. So those in favor, please indicate. I have 20 in favor.
22.
So that motion is carried. Thank you. The next item.
Mr. Chairman, it's Alan. Could we ask for those opposed and abstentions, please?
Sure. Okay. So in that case, lower your hands, everyone, again. Those who were opposed to that motion.
I believe I actually saw 22, Hanno.
Oh, did you? Okay.
Vote. Yes.
Okay.
2 came in late.
Okay, that's fine. If there was 22, then that carried unanimously. Thank you. The next one is motion number 5, which is the cooling off period. So if we could just see that on the screen, please, Angelo. And that is that council approves a 3-year cooling off period for elected and selected council members who have served the term limit, i.e. 3 consecutive terms or 9 consecutive years. And that is moved by Mark Trudell, seconded by Anthony Lisho. And again, this is a simple majority required. All those in favor, please raise your virtual hands. And that is carried unanimously. So thank you very much for that. So now, if I'm correct, the next motion, this is the motion where Harinder, Nalan, and Aaron will be placed into a breakout room. Is that correct, Dan?
If I could see the motion.
Oh, sorry, it's motion number 6 that we approve the following model for implementing staggered terms for elected.
Correct. You're correct.
Okay, so Angelo, again, if you could please place those 3 into a breakout room. And Iliad, I see your hand up, so I'm going to take your question before we put the, oh, not up. Okay, so if I could have motion number 6 on the screen, please. It is fairly lengthy. And that motion is that council approves the following model for implementing staggered terms for elected council members at the December 2026 inaugural province-wide election, extending the terms on council of all 3 current executive committee elected council members by 1 year following the December 2026 election, and designating the remaining 7 elected council member seats as open for the December 2026 province-wide election. The 3 terms of office of the 7 elected council members would commence at the first meeting of council following the December 2026 election and end as follows. The 3 elected dentists to receive the highest number of votes out of all dentist candidates in the province-wide election would be elected for a 3-year term. The 3 dentists who receive the 4th to 6th highest number of votes out of all dentist candidates would be elected for a 2-year term, and the one dentist who receives the 7th highest number of votes out of all the dentist candidates will be elected for a 1-year term. So that is the motion for your consideration, Council. It's moved by Ram, seconded by Brian. Are there questions or discussions or comments to be made? So maybe everyone put your hand down. I want to give people an opportunity if there was something that needed clarification on. Jamie.
Thank you, Hanno. I've heard the comments earlier about the 1-year term. I totally agree. You're barely learning various aspects of the responsibilities of a council member and or the workings of the council. I don't think you're doing the dentist any favor at all by having a 1-year term.
Okay, thank you for that comment, Jamie. I have no one else. O'Neill, is this a comment?
It's a question. Will there be a yearly election for the executive at that point? Because you're having new people coming up on staggered terms.
Anne, can I turn that over to you?
I think Dan
Claire.
can respond to that.
Yeah,
It's a
I don't think
bylaw issue. Yeah.
I don't think we're there yet, Neil, but it
Okay.
is a live question before the governance committee as well, and obviously the executive committee and council. And I want to just be clear too about the staggered terms and that individual that would have a 1-year term. And I think others have said this, but first of all, it could be a returning member. So you already have a learning curve that has been navigated. Also, it's a one-time. You know, it's as Anthony Mayer said, it's a way to deal with the math of figuring out how to go from what we are doing currently to a staggered process. And so it's a one-time event. And after that, then everyone becomes elected for 3-year terms.
Thanks for that clarification, Dan. Anthony Lisho.
And it is my understanding, to answer Jamie's question, is that that individual is able to run again. So it's not that that's the end of the road for them.
If they have not been in service for 9 years, the answer would be yes.
Okay, thank you for that as well. So I have no one else on my list, so I'm going to now entertain the motion which has been moved and seconded. So all those in favor of that motion, please raise your virtual hand. Again, this is a motion that requires a simple majority in order to pass.
And Hanno, just for your information, there are 19 voters with the removal of the 3.
So that's 13 in favor. So if those people would lower their virtual hands, please. 13 in favor. Those opposed, please raise your hands. Okay, and that's 6 opposed. So that accounts for the 19 who could vote, and that motion carries. Thank you very much. Thank you, Anne and Lara, for that presentation and for the incredible amount of work that you and your team have done. Thank you, Council, for your discussion and all the questions and the concerns and the comments that you raised. Thank you again for your patience in terms of the technological glitches. But in the end, I think we dealt with it really well, and we're only 4 minutes behind. So that's a bravo to all of you guys. Alan.
I just want to point out to council that some of the motions you've dealt with and approved today will ultimately come back to you in the form of bylaw amendments, which will require at least a two-thirds majority vote to approve and substantial amount of time and effort to draft. So that if individuals have questions, ongoing questions which need response, I would encourage you to contact the appropriate people to get the information you need to make an informed choice as early as you can, because As I say, there's a lot more work to do to actually implement these changes, which apparently are going to come back by way of bylaw amendments in September.
Thanks for that assurance, Alan. At this point in time, Angelo, if you could bring the people in the breakout room back, and if I could ask you to put Noah into the breakout room, we are going to deal with one more quick item before we break, and that's item number 8 on our agenda.
Thanks, Hannah. We're ready.
Thank you so much. So Council, one quick item to address before our break, and that's item number 8, and that's the University Selected Council Member. This is in regard to the University appointment to Council. The Dentistry Act sets out that RCDSO's council, in accordance with the college bylaws, shall include 2 registrants who are members of a faculty of dentistry of a university in Ontario. Council is being asked to review proposed changes to the rules about who can serve as academic members, primarily in order to improve equity. Given that this item is about academic members, we have asked Dr. Noha Goma to step out. She is in a waiting room right now as we consider this matter. The material in your package dealing with this matter could be found on pages 311 to 331, and this is an item for your decision. And Anne, I'm going to turn it over to you again quickly to walk Council through your proposal or the Governance Committee's proposal.
Thank you. The proposed bylaw amendments brought forward by the Governance Committee are in regard to the eligibility requirement that university-selected council members maintain a full-time appointment of professorial rank in the faculty or School of Dentistry that selected them. The registrar noted that the eligibility requirements set out in bylaw for university-selected council members may present barriers to equity and capacity to serve on council. Specifically, they require academic council members to have a full-time appointment of professorial rank to be eligible for selection to council, and to maintain a full-time appointment to avoid disqualification. The Governance Committee discussed the purpose of the faculty appointments and whether the eligibility requirement should be amended to fulfill the aim of the appointments in a less restrictive manner. Committee agreed the role requires a dentist knowledgeable about the current academic environment, the direction the university is headed in, and an individual who can bring the perspective of the faculty to the role. Faculty members in the positions of assistant professor, associate professor, and full professor have obligations within their appointments that typically involve a combination of teaching, research, and/or other faculty responsibilities. Finally, the Governance Committee noted that requiring an academic council member to hold a full-time faculty position is inconsistent with the employment status eligibility requirement for elected council members. The committee was in agreement that the proposed revisions to require that the member holds an appointment of assistant professor, associate professor, or full professor in the faculty or school that selected the member, and the related changes to the disqualification criteria would continue to fulfill the aim of faculty appointments while promoting equity and capacity to serve on council. I'll turn it back to Hannah, please.
Thank you for that, Anne. So, Council, for your consideration, could I have the next motion on the screen, please? And that motion is that Council approves the proposed bylaw amendments to Article 8.1.1 and Article 14 as shown in the red-lined version of Appendix A. So if I could have a mover for that motion, that's moved by Anthony Mayer, and that's seconded by Aaron. Just a reminder, since this is a bylaw change, we are looking at a 2/3 majority. So we would need a minimum of 14 people to approve that in order for this motion to pass. So all those in favor, please raise your virtual hand. Okay, I'm seeing 20 in favor. So if you could lower your virtual hand, or yeah, lower your virtual hand. 20 in favor. Okay, lower your virtual hands, please, if you voted. Those opposed? None, so that is one abstention. So thank you for that, Council. Angelo, we can bring Noha back in. And again, thank you, Council, for the incredible amount of work and participation done to date. It is now 10:50. We'll take a break until 11:05. So I know Harinder has his hand up. I'm going to let him speak, but once he's finished, we will do a 15-minute break. And I would just ask that you then mute yourselves and turn off your camera during that break. Harinder.
Hannah, thank you very much. I really want to thank all the council members for bringing their questions, comments, and given the feedback to the governance committee. Thank you so much. And also the governance committee, I know the difficult task they had. I'm absolutely amazed at the document they have brought in front of us. And I know that it's an evolving process. So I also want to reassure the council members who still have some question in their mind that during the implementation, all their concerns and during the bylaw changes we're going to make, they will be addressed. So thank you so much again. Really appreciate that.
Thank you, Harinder and Council. You've got, unfortunately, not a long break, but a well-deserved break. We'll see you back here at 11:05. So just turn off your cameras and mute yourself. Thank you very much. Okay, welcome back, everyone. This next item on your agenda is in regard to the college's audited financial statements and the appointment of the auditor. As part of compliance and good governance, the college undertakes an audit each year. The material in your package for this item can be found from pages 332 to 382, and this item is for council's decision. There will be numerous motions, and we will consider them separately. Mark Trudell, Chair of Finance, Audit and Risk Committee, will make some introductory remarks, and then Kelly Tripp, Director of Finance, will first walk us through the audited financial statements and the appointment of the external auditor. Kelly will also take us through the reserves topic. So at this point in time, I'm going to turn it over to you, Mark, please.
Thank you, Hanno. Good morning, members of council, staff members. It's great to see everybody logged in here this morning. I'm pleased to present to you the report on the audited financial statements, which begins on page 332 of your materials package. At this moment, I'd really like to express my gratitude to my colleagues on the Finance Audit and Risk Committee, otherwise known as FAR, F-A-R. I'd like to thank them for their participation, their commitment, their expertise, their support, and specifically those members are Miriam Pazeshki, Neil Gajar, Peter Deline, Neil Silver, Jamie Colliver, and Harinder. So thank you. Un gros merci to each of you. Thank you. A primary duty of FAR is to review the external audit process of the college, the financial audit process of the college, and that includes a review of the financial statements to ensure that these statements are reasonable and that they can be recommended to council. Two sets of financial statements are prepared for the college, those being one, the RCDSO financial statements as referenced in Appendix B, and secondly, the fund financial statements of the RCDSO pension fund, which are found in Appendix C. So two separate statements. Motions for the approval of each of those financial statements are included in your materials package. And there's also a detailed financial commentary that's been provided in Appendix A, which gives you some context regarding the numbers and the notes found in those statements. The financial auditing firm for the college, Tinkham LLP, continues to be thorough, very well organized, and our committee, your committee, FAR, recommends that they be appointed as auditors for the 2025 financial audit. A motion for this recommendation is included in the package. The role of this external auditor, just to clarify, the role of Tinkham LLP is to provide an opinion on the financial statements that are provided by college staff. So college staff prepares the financials, they're reviewed by the external auditor to ensure that there's no significant deficiencies and to establish or confirm that appropriate internal controls are in place and operating effectively. The auditor has issued, Tinkham LLP has issued an unqualified, otherwise stated, a clean audit opinion, indicating that there is reasonable assurance that there are no financially material misstatements in our financial review and our financial documents. The auditing partner and audit manager from Tinkham attended our April FAR committee meeting, at which time he presented the findings of, or their team presented the findings of the 2024 financial audit to our committee. In their report, they explained the independence standards that apply, the steps that they undertook in carrying out the audit process, and the audit risks that they really honed in on, that they focused on. Members of our committee also had an opportunity to meet with the audit partner and the audit manager, both from Tinkham, and we did so in camera, specifically without the presence of college staff, the objective of which was to ensure that there were no issues of concern and to allow them the opportunity to express that, communicate that independently. So at this point in time, I'd like to call upon Kelly Tripp, the college's Director of Finance, to make some brief comments on the highlights from those financial statements. And then we will be pleased to take any questions that members of council might have. After that discussion, after Kelly's presentation and the discussion that follows, we'll present recommendations for the operating reserve of the college, the financial operating reserve. Please refer to page 374 in your materials for that information. At this point, Kelly, over to you, please.
Good morning, everyone. Thank you, Mark. So I will just draw your attention to a few highlights from both sets of financial statements. So as Mark stated in Appendix B, which starts on page 344, that will be where we're looking at the college financial statements. So the college statement of financial position shows how the college is doing at a specific point in time, providing a snapshot of its assets, liabilities, and net assets. There are several positive indicators, and the college remains in a strong financial position. So some highlights are that the cash and short-term investments are total 24 million at the end of the year, which was up 1.1 from the prior year. Long-term investments, 69.9. There's a shift from ETFs to GICs and bonds, so it is up in long-term this year as well. The internally restricted resources, which we will get into a lengthy discussion, not too long, but I will do an actual slide deck on the internally restricted reserves, but they're 26 million at this point in time at year end, which includes the PLP reserve at 22.5 and the operating reserve at 3.5 million. And the unrestricted resources at the end of the year was 9.9 million. The statement of operations shows where we ended the year. So we ended the year with a surplus of 8.9 million. Comparatively to 2023 was 4.8 million. We exceeded budget by 6.8 million, which is a good news story. And we'll get into why that's a really good news story for us and our reserve. The revenue was 45 million, up 2.9 year over year, which was driven by an increase in registration and annual fees of 2.2 million and an increase in the investment income of 835,000. Expenses were at 36 million at the end of the year, which was down 1.2 million year over year, with staffing costs comprising about 59% of those expenses. $1.8 million, there was a $1.8 million increase in the staffing costs. Three main factors. There was increase in staffing cost expenses related to extended health benefits, was higher year over year due to an increase in claims made. There was a $3.1 million decrease in the PLP loss provision, which is driven by the actuarial assessment completed at year end. The second set of financial statements requiring approval is the fund financial statements of the RCDSO pension fund. The requirement for the pension audited financial statements is based on reporting regulations of the Pension Benefits Act and are reported to FSRA to meet their requirements, which is reflected in the auditor's report. Under the basis, the actuaries' liabilities of the plan are excluded. So these financial statements are not indicative of the adequacy of the plan's assets to meet its pension obligations and should not be used for that purpose other than to satisfy our regulatory obligations. Appendix A, which is on pages 334 to 343 in the package, provides a lot more detail about the statements which are available. And if there's any questions, I'm happy to address those. And then I will turn it back over to Hanno for the motions. And just as a reminder, following council, we also will be filing our tax return, which is due at the end of this month. And then we will be submitting the pension statements to FSRA. And then we will include the financial summary statements in the annual report. Back over to you, Hanno.
Thank you. So at this point in time, are there any questions for Kelly or Mark? Seeing none, could I have motion number 8 on the screen, please, for council's consideration? That council approves the December 31st, 2024 RCDSO audited financial statements as presented, and that the president be asked to sign an official copy on behalf of council. That is moved by Deborah, seconded by Anthony Lisho. All those in favor, please raise your virtual hand. This just requires a simple majority. So I'm seeing 21 in favor. Angie and Dan, are you seeing 21 as well, or are you seeing 22?
No, I see 21, and I think Harinder, I didn't see your hand.
Okay. In that case, that is carried unanimously. Thank you very much. Kelly, do you want us to move on to the next motion, or did you want to speak to that briefly first?
No, you can walk through all the motions. I think I've discussed all of the items that are being.
Okay, so if we could have motion number 9 on the screen, please. And that is that council approves the December 31st, 2024 audited fund financial statements of the RCDSO pension fund as presented, and that the president is asked to sign an official copy on behalf of council. That is moved by Iliad, seconded by Judy. All those in favor, please raise your virtual hand. And again, this just requires a simple majority. And that is carried unanimously. Thank you. And the last motion for council's consideration is motion number 10 on this item. That council approves the appointment of Tinkham LLP to conduct the RCDSO audit and the RCDSO pension fund audit for the year 2025. That is moved by Neil, seconded by Nalan. All those in favor, please raise your virtual hand. This as well just requires a simple majority.
Mr. Chair?
Yes?
May I ask a quick question?
Oh, my apologies. Please do.
I just realized that as the chair of another board, we also have Tinkham as our auditors. So I'm not sure if I'm in a conflict of interest to nominate them or to vote in favor of them being the auditors for the council. Do you or Alan have a perspective?
I will turn that over to Alan. Thank you, Nizar, for raising that.
Without knowing all the background, I can't answer the question, but I think you could abstain just on the basis of what you told us.
Okay, then I abstain on that basis, Mr. Chair. My apologies for not realizing earlier.
Oh, not a problem at all. Thank you for raising that when you did realize it. So again, all those in favor, please raise your virtual hand. That's 21 in favor, 1 abstention. And Alan, do we need to identify that the abstention is from Nizar, or is just the fact that 1 abstention, is that good enough for the records?
I think you have already identified it for the record, so that's fine.
Okay. In that case, thank you very much. That motion is carried. And Kelly, I'm going to turn it back over to you now to do your presentation on reserves, please.
Thanks, Hanno. The slides to go up. Okay. So today we're going to be discussing the financial reserves briefing note that's included in your package on pages 374 to 375 for council's decision today. Feel free to ask any questions you might have at the end, and we will go to the next slide. So today, what we are looking for is the purpose is really the briefing note is to seek the approval of $4 million into the operating reserve. This decision is crucial to ensure our financial stability and preparedness for future needs and to meet the minimum requirement from CPMF. As council will be aware, we've been discussing this for some time now, so I think we have a good news plan here today. We can go to the next slide. So the background is that the policy was approved in November of 2020 and has been reviewed by the external auditor. We have two key reserves, the operating reserve, which is the CPMF government requirement, and the PLP reserve, which is for significant legal cases. Any new reserves or funding of existing reserves do require council approval. Next slide. So the operating reserve overview. The operating reserve is essential for maintaining stability and covering unforeseen shortfalls. Our target based on the audited financial statements from 2024 is 7.5 million, but our current balance is only 3.5 million, leaving a shortfall of 4 million. A plan was developed to fully fund this reserve over 3 years, from 2023 to 2025. With a 2024 surplus of 8.9 million and an unrestricted balance of 9.8 million at year end, we are in a good position to meet our target and fund the shortfall of 4 million. So on the graph here, you can see for 2025, the green bar would represent if council approves this transfer, that we will actually be aligned with the target in the blue bar. Can go, I see that there's questions. I don't know, do you want me to address them now? Or hands up, sorry, I should say.
I think those hands up may have been left from the last vote, but are there questions? Would you like to address them now, Kelly, or do you want me to wait until you're finished?
I can stop if somebody has a question about something I've already mentioned.
Okay. So I see Rod's hand is up, so I'm going to turn to Rod.
Yeah, just a quick one, Kelly. You may answer this as you go along, but I see some verbiage to the effect that some operating reserves are 6 to 9 months and some up to 12 months. Have we ever considered that, and what does our minimum operating reserve represent at thus far?
Yeah, sure. So I can address that in the next slide. You're right.
Okay, so you're probably going to talk. Okay, thank you.
Yeah, no problem. Okay, so we are proposing a transfer of the 4 million from unrestricted to operating reserve. This will help meet the minimum target. So the minimum target that CPMF set out is 25% or 3 months of expenses. In discussion with the auditors, they did address that best practice suggests having anywhere from 6 to 12 months of reserves would be appropriate and reasonable. But what I will get into as well is we've discussed that we want to at least meet the minimum target for right now, because as council is aware, we are also in the midst of the PLP divestment. So we have an opportunity to always fund beyond 25% because our policy states it's a minimum. But at this point, we're recommending that we at least meet the minimum target. And when we do that, we'll actually be 1 year ahead of schedule, because originally we were thinking that we might not be able to meet this target until the end of 2025, fiscal 2025.
Kelly, do we have a long-term proposal as where we'd like to be, ignoring PLP once that's in place, but let's say 3, 4, 5 years down the line, where we'd like to be?
I think we will be discussing this with FAR, and we did already at our meeting that we had in, can't remember what month it was now, in May, or in April, sorry, we had our meeting. We did discuss what that's going to look like. And what I can jump ahead, but in our slides, one of the things that's going to happen is we're going to revisit this policy post PLP divestment, and then we can realign what our target might want, what targets we might want to achieve.
Okay, thank you.
Okay, so we can go to the next slide. So the PLP reserve is designated for significant legal cases. At December 2024, the balance was 22.5, and there are no changes to this reserve due to the divestment being in progress. So once the transition is complete, this fund is actually going to need to be dissolved. And that will also have to come through council. Next slide. So the college does need to consider surplus management or excess of 2024 surplus, which will be held in the unrestricted balance. So until the PLP divestment is complete, we have recommended that the dollars involved in the divestment transaction are still significant, and the college needs to be responsible in managing funds and risks and prepare for those unforeseen risks. The policy delegates authority of the operating and PLP reserves to the registrar or CEO and or the CFO along with the FAR committee. So, but all reserve activity will be approved by the FAR committee and must be reported to council at the subsequent meeting. So nothing will happen without council being involved. So the next steps are going to be including reflecting the fund transfer in the June internal financial statements pending approval today. We will be updating the reserve policy, as I mentioned, post divestment, and then we will be able to confirm CPMF compliance in the next reporting cycle. So I will turn it back to Hanno, unless there's any other questions that I can answer first for the motion. Thank you for your attention.
Thank you, Kelly. Any questions for Kelly before we put the motion on the screen? Okay, Brian Smith.
No, I was just voting, Mr. Chair. Sorry.
Okay, let's put the motion on then, please. Motion number 11. For your consideration, council, is that council approves the transfer of $4 million from unrestricted resources to the operating reserve. And that's moved by Brian Smith, seconded by Anthony Lisho. And this again just requires a simple majority, so please raise your virtual hand if you're in agreement. I see 21 in favor. So lower your hand, please. Lower your hands, please. Thank you. Those opposed? So that would then be 1 abstention. Thank you for that. We will now turn to the final matter for your consideration, and that is, Harinder, did you want to speak?
Yeah, Hannah, thank you so much. I just want to thank Mark Trudell for the leadership of FAR, and also acknowledge Dan, Jeff, and Callie for their financial stewardness, landing us where we are. A few years back, we were really struggling financially, and I'm so happy to see that we are in black now, and we have moved some money into our operating surplus. Reserve, sorry. Thank you so much for your work.
Thanks for those comments, Harinder. The next item and final item in this instance or matter for your consideration are fee changes for 2026. As part of the divestment of the professional liability program, fees for 2026 will need to increase. Since the process of divestment began, it was clear that the RCDSO offering was significantly underfunded, and its estimated cost was also well below current market rates. Liability and regulatory fees will remain lower than in most other provinces in Canada. The material is in your package from pages 376 to 382, and this is an item for council's decision. I'm going to hand the floor over to Dan to lead the discussion, and then Margot Orchard will walk council through the material. So Dan, it's over to you now, please.
Thank you, Hanno. And I will start by providing you with some background on the PLP divestment. Obviously, there are parts of this that are still confidential, but I want to be able to provide you with an update on some of the background just briefly and why we're talking to you today about the fee component. And the fee component that we're going to talk to you about today is related to the PLP portion of our annual fee. There's a slide deck. I'm wondering if it could come up, please. So I will provide an update, as I said. Between Margot and I will explain the increase and then obtain your approval in principle. We'll also talk you through, because we have a little bit of uncertainty, but we will likely need to go to the executive committee for finalization before bylaws are circulated in July, but you'll have more opportunity to hear that in a moment. Next slide. And the next one, please. So just a real quick refresher. PLP has been in operation for more than 50 years, since the early 1970s. RCDSO is one of the very few health regulatory colleges in Canada that directly operates an in-house liability program. There are a couple of others, and we've talked about those before, but really we're in the minority in operating a program of this nature. Back in 2022, Council established a task force, and that task force was operational in 2023, meeting from January to July, and really looking at a number of features of PLP and the college, thinking about the expectations of professional regulation, thinking about RCDSO's commitment and actual legislative mandate to act in the public interest, and also considering some of the reputational issues, including negative media stories that certainly were a part of taking a closer look at the risks and benefits of the college operating PLP. Next slide. So again, this you've seen many times, and I'm not going to prolong it. We acknowledge that there are many benefits to the program, and specifically to PLP that the college has operated. We know that the public is protected. We know that every single dentist, by virtue of their their annual renewal payment to the college, is going to have coverage. And to some degree, we're able to influence the policy or the insurance policy and what it covers. But then we also know that there are risks, and they range from reputational to financial to regulatory. Those have been described in great detail in previous documents that are on our website, including council materials back from September and December of 2023. The council decided that the risks outweighed the benefits. Next slide. And so what happened was, in September 2023, council did decide that it needed to explore divestment, and it directed staff to look at the different ways to do that. In the interim, while we were working towards the model that council would consider, we collected more information. What you don't see on the slide is that we collected information from staff in PLP. We wanted to know from staff, what is it that makes this program of value to the public and the profession? What do you do in the program that really serves the program's purpose? We also conducted a survey of members. It went out to all 11,000 plus dentists, and we got 1,600 back. And then we brought all of that information, including divestment options, to council in December 2023. And council agreed to move forward with identifying a third party to take on ownership of the PLP program. Next slide. I also want to remind you that there is a subgroup of council that was established back in 2024, early 2024, the Procurement Review Group, or PRG. That membership you can see on the screen, and it is there to serve council. It's there to ensure that the divestment proceeds effectively and efficiently. It's there to ensure that the questions that come up along the way are addressed, that direction is given, and it's there to ensure that the objectives that we set out to accomplish are. So it has been operational since January 2024 and has done an incredible amount of work in a short period of time with our external advisors, PricewaterhouseCoopers. Next slide. This is really an important slide, and it captures the 8 objectives that council and PRG have from this divestment. And anyone coming forward to express their interest in PLP, we needed to understand how they would meet most, if not all, of these objectives. And as I've described it previously, on the left-hand side, there's some very technical components that we wanted to ensure would be satisfied. And as you move towards the right, you look at some of the objectives that relate to integrating PLP staff into the program, how we continue to provide that valuable service through staff to dentists that are part of the claims process, but also many other inquiries that come in that help to keep dentists away from trouble and help them to deal with difficult situations. And then finally, we wanted to ensure that the relationship that we have with the new entity running and operating PLP is going to have the capacity and the ability to work with the college and think about how we use data that's available to both programs to drive education and to drive risk management. So all of these objectives have been considered by the PRG, by you, Council, and by the proponents that have expressed an interest. And I'm not going to talk about some of the more confidential and sensitive matters at this point, but certainly we're quite confident that we are able to move forward with all of these objectives. Next slide. And I also want to just give you a very general update in terms of where we are. And you can imagine this as a funnel. Phase one, we had a large number of possible entities that were interested. That was narrowed down into a smaller group who completed expressions of interest that were all reviewed and evaluated by the PRG. Again, that was narrowed down, and there were management presentations where we presented to those groups so they could better understand the program. And then that was narrowed down further to the small number of interested parties that expressed a formal letter of intent. And now we are working towards a signed agreement. We are working through all the legal due diligence with a preferred party. So we have really ramped up the process in the last year, keeping in mind that the first phase one started in September 2024. So still lots of work to do, but we are certainly narrowing in on more information that will be available to Council. Next slide. And upon completion of the process, I think it's really important to remember that the public interest is going to be maintained. That's been our #1 priority throughout. All dentists, all members will continue to have mandatory liability protection. The college won't operate PLP, and that will reduce or eliminate our risk in those areas that I highlighted earlier. And the college will have satisfied most, if not all, of those divestment objectives, the 8 objectives that appeared on the screen earlier. Next slide. So I'm going to turn it over to Margot Orchard now, and she's going to walk you through why we're asking you to consider a fee increase for the PLP component of the annual renewal fee. Margot, I'll turn it to you.
Thanks, Dan. Hi, everyone. Next slide, please. So I'll just start off by providing a quick overview of the typical process for setting fees at the college. At this time, every year, the college assesses whether there is any need to change the fees for the coming year's annual renewal process. And if any changes are needed beyond the automatic cost of living increase, these changes need to be brought to Council, circulated for 60 days, then brought back to Council in September for formal approval. The annual renewal process starts in October every year, and so it's critical that the fee changes get approved in advance of that date. And we're here today because it has been determined that a fee increase is required related to the professional liability program. Next slide, please. Before I get into the details of the fee increase, it's important to explain the way the fees are currently allocated. The bylaws outline an annual fee that is currently set at $3,170. And of this, the majority, $2,170, supports the college in meeting its statutory and regulatory obligations. There's also a portion of the annual fee that is used to obtain professional liability protection for all members. And this amount was identified in 2022 to be $1,000. When it was originally set, it was based on an estimate to provide some transparency to registrants and show what proportion of the fee is used to fund the PLP. But that $1,000 wasn't intended to represent a premium for an insurance policy, and it didn't include any of the indirect costs that are needed to run a professional liability program, things like HR, finance, IT, communications, administrative fees, and others. And it also hasn't changed since it was originally been communicated in 2022, even though inflation and changes in the liability profile have taken place. Next slide, please. And so we're here today to propose an increase to the college's annual fees related to PLP. As Dan mentioned, the divestment process is proceeding well, and we're anticipating a successful transfer to a new third party to take place for January 1st, 2026. To help make this happen smoothly and to ensure there are no gaps in coverage, the college will need to continue to collect the PLP portion of the fees for 2026. This will not be a long-term solution, but it is a temporary requirement, at least for 2026. The amount that the third party needs to ensure the coverage is provided to all members is higher than what's currently allocated for PLP, and so a fee increase is required to support this. Next slide, please. At the time of drafting the briefing materials, we didn't have certainty on the exact amount that would be required to support the PLP program. But it was important to have the discussion today in a public council meeting. And so we presented a range in fees with the intent that the executive committee would provide final approval at a later date within that range. The range we identified was between $1,500 and $1,650, which represents a $500 to $650 increase from the $1,000 currently assigned to PLP. Of this, we have identified $1,400 as the amount required to provide the same level of protection currently in place for Ontario dentists. This amount is more appropriate than the $1,000 set 3 years ago, as it considers the growth in inflation as well as the indirect costs associated with running the program. It's also a fair and competitive rate. When compared to what other dentists in other provinces pay for similar coverage, the new amount is lower. And finally, the amount is sustainable. The $1,000 that was set in 2022 was artificially low and subsidized by the college's regulatory fees. And this increased amount will allow the new program to successfully operate under separate from the college. Now, the exact amount needed to account for the additional administrative costs on top of the $1,400, such as taxes, technology costs, and policy issuance fees, was not confirmed at the time of developing the briefing materials. We're getting close to confirming that this amount will be limited to $100, bringing the total PLP portion of the fee to $1,500. This means the increase in fees we're expecting is $500, which is at the low end of the range that we presented. But for today's purposes, we're going to continue to focus on what was in the briefing materials, and we'll be looking for approval on an increase in a range of fees between $500 and $650. And then we'll be bringing the exact amount and the bylaw changes to the executive committee for formal approval. Next slide, please. It's important to highlight that the college is not proposing any changes to the regulatory portion of the annual fee. The regulatory fees are essential for the college to meet its statutory and regulatory obligations. But as you've heard from Kelly, the college's operating reserve has been established, and the 2025 financial outlook is expected to remain on budget. And so no increases to the regulatory fees are required. It's also recommended that the automatic cost of living increase that is typically applied to the fee each year be suspended. This would be a temporary suspension for 2026 only and is intended to provide some financial relief given the increases that are required for PLP. Next slide, please. So to summarize, what we're looking for today is approval in principle on a proposed fee increase specifically related to PLP. And we're presenting a range today between $500 and $650 with the exact amount to be approved by the Executive Committee. We're also looking for approval to suspend the cost of living increase temporarily for 2026. And I should also note that when the bylaws are brought to Executive Committee for review, they'll also indicate a change to the fees for registrants that are issued their certificates midway through the year. People who are issued their certificates after June 1st and after September 1st pay a smaller amount, and this amount will be revised to reflect the increase using the same methodology as always. Next slide, please. So next steps in terms of the fee increase are as follows. We're looking today for approval in principle on a fee increase required for the new PLP program. Once we have confirmation on the exact fee, we would bring this to Executive Committee. Executive Committee would be asked to authorize the college to circulate that fee increase and the corresponding bylaw revisions for the required 60 days. And that circulation needs to begin by early July so that the 60 days can run their course and we can bring the final bylaw amendments to council at the September meeting. In terms of the divestment, the next major milestone we're looking at is being able to publicly announce the new third-party provider. This needs to remain confidential until all the legal agreements are signed, and we're hoping to have this finalized over the coming months. Next slide, please. I've highlighted the key decisions for council on this slide. I think I've spoken to them in enough detail that I don't need to repeat them again, but I'll just pause here and pass it back to Dan and Hanno.
I can pass right to you, Hanno, so that you can manage the motions and discussion.
Okay, thank you. Thank you for both to Margot and Dan for that. So council, what you're going to be asked to do is you're going to be asked to address 3 motions based on this. Before I put the first motion up, were there any questions of clarification for either Margot or Dan? Rod.
Not to play devil's advocate, Dan, I was, as we proceed on this, I just wondered, given our discussion last week at the strategy sessions, is there anything I imagine that should be considered in light of? And I was thinking of, as we go forward, the more collaborative, engaging, I guess, foot that we are going to be taking with members going forward. Is there something we should be doing perhaps to soothe this over? Are you comfortable that this is in line with that? This is going to be perceived by some as being fairly heavy increase, upwards of 40 or 50% of what they're paying now. And the optics of that, maybe even, given that we have a $9 million surplus recently, might be challenging. So I just thought I'd throw that on the table as a discussion item.
Dan?
So Rod, I think I'm gonna respond to the collaborative part of your question more generally, because as you saw from the objectives on the far right, one of the objectives that we went into this whole process was to build a strong relationship with whoever took over the ownership of PLP. And obviously there's not anything that we can talk about right now in a public setting, but there has been a lot of work in really trying to establish that longer term relationship with that entity. So that's sort of a general collaborative statement. On the issue of the fee increase coupled with the surplus, I mean, I think we're at an interesting time for the college as well, that the surplus that you heard about this morning in our audited statements is a point in time. Kelly talked a little bit about still some uncertainty around this transaction that we are going through with a third party. We will also have a strong communication plan around not only the fee increase, but also when we're able to talk publicly about this transition, there are a lot of positives to it as well. And so I think we'll have a lot to talk about, which unfortunately, given our bylaws and when we have to get the fees nailed down, don't necessarily line up the way we would have liked them to. And the final point that I would make is not that it's any consolation to the Ontario dentist necessarily, but we did provide a comparative chart to show where we are with respect to the rest of the country and the fees that are paid. And I think we are very comfortable within that space, that we are not the highest across the categories. And so, all of that being said, we're going to work with the profession and really ensuring that we explain this well, and also dealing with the uncertainty that I think if we're sitting here a year from now, we will be able to ask some different questions about the financial situation of the college, where we will have a lot more information that's known that we don't necessarily know today. But we're in a good spot financially, and we're trying to balance a number of these different issues as we move forward.
Thank you.
Dan, just a supplementary, are the members aware of any of this? Or to what extent are they to date? And we keep saying this is going to be market driven, and it's considerable based on what they already have out there. So will this be a surprise to them, or do you see it?
Well, the public documents for council went online on our website on Monday. So that's the first time that we've talked about it openly. I think where we have been talking with the profession is there was concern that I heard, and others on the screen may have heard things, that we would not decrease the $31.70 that we were currently charging. They thought that we would continue to collect that as the regulator, and that there would be this separate insurance fee that would be required. And we assured members as we talked to them that we wouldn't be charging the $31.70 for their regulation activities. So we will have more communications moving forward, but directly to your question, the membership is seeing this at the same time that you are.
Thank you. Aaron.
Yes.
Thanks.
To echo what Rod was saying, I'm also a little concerned about the optics. We've just had a great presentation, and the big takeaways from that are that we're in a very good position financially. I was wondering if the college has considered alternatives to funding this shortfall. I know in the report I saw that it would be a little bit of a hit, but this is, as you mentioned, this is a one-time thing. So it's not going to be the next 5 or 10 years that we're going to be charging this fee once the program is divested. The other thing that I noted in the financial statements that we saw is there are fees involved in this process that we're paying that won't be in our budget next year, or whenever the transaction is finished. So I guess I have 2 questions. So have there been other sources considered to cover this? Maybe taking a little more time to pay down the operating reserve instead of doing it right away. Well, okay, one question. We'll start with that.
Thank you.
Others may want to comment, but Aaron, the Finance Committee spent a considerable amount of time looking at this issue and looking at alternatives where the college would subsidize this, and it was to the tune of several $1 million. And the Finance Committee, and I don't have the motions in front of me, I don't need them, but this is a recommendation from the Finance Committee. The Finance Committee looked at the alternatives in terms of what we might subsidize, but agreed that we should provide this fee increase as it's being structured and presented to you today. And Mark may be able to speak to that as well.
It is a bit of a hit, but if we look at the big picture of our financial goals, if we take this hit, do we still have enough money to do what we need to do? And will we have enough money going forward once this process is done and everything is stabilized? Because it's not our goal to make as much money as we possibly can, like being a public entity. We just need to have enough, is what I'm saying.
Aaron, I agree with you. And in no way is this trying to collect as much money as we can, but we do have a considerable uncertainty until we actually get a little bit further along into the summer with the negotiations around the third party and PLP. Someone mentioned earlier, probably Kelly, about the reserve that we have for PLP and what gets transferred over to deal with the claims that are on the books already. And that's where the big uncertainty is. So if we start to take dollars from subsidizing this fee, we also don't know what that might amount to. And certainly, I'll look to Mark or others from the Finance Committee because this did have considerable discussion.
Corinne, your hand up to deal with this.
Thank you, Dan. Thanks, Hanno. Just to provide further clarity, our prime, there are two separate issues: operating reserve distinct from the PLP divestiture. Having said that, there is a dotted line relationship, and comments were made about our significant surplus financially in the current year. I'd like to think that's a reflection of good corporate financial management as well as corporate governance. Point number one, the operating reserve, our college, this college, and this board, the council, really, we've been in remiss to not really want to address the requirements of CPMS as soon as possible. So that is to say, FAR looked at this through the lens of wanting to address that requirement as soon as possible, and in an ideal world, have that addressed in advance of the PLP transaction. So there would be no perception by third parties that PLP is related to meeting the the operating reserve. In other words, generating revenue in order to address. So we wanted to position the college to be responsive to the CPMF, to be well positioned, which I believe is in the best interest of this council and members of this council in terms of good corporate governance. So when we talk about the $9 million reserve, positive in terms of the financial statements, well, if we extract what has now been approved by council to address the deficit in terms of operating reserve, it leaves us with ballpark about $5 million in terms of a surplus. To Dan's point, we have a reserve in terms of PLP, but there is a high degree of uncertainty and some risk as to whether the number pegged by our actuaries will respond to and align with that of the third-party firm that will acquire PLP. So the potential exists, to be quite succinct, the potential exists that the preferred third party in terms of acquiring the responsibilities of PLP, that they may conclude that we're in a deficit position in terms of our reserve for PLP. And that in turn could position us that at the time of closing of that transaction, that we would be in a deficit financially. That is to say, we have a $5 million surplus, but that's predicated on the fact that we think our operating reserve, or rather our PLP reserve, addresses the mark. We could find out it's not sufficient. So the potential exists that at the time of this transaction, we'd be in a negative. So we are trying to position the college to avoid that situation, because that would in turn result in the need to look at fee increases or how to navigate a deficit operationally, financially.
Okay, thank you. I have a significant speakers list I'm going to go through. Kelly, I saw your hand go up. Do you want to address this, or you just want to go on the speakers list?
Yeah, I just wanted to address one point to just make sure that it's clear. The increase that we're talking about, although it appears it's embedded into our annual fee due to the timing that Margot addressed in her presentation, the $1,500 or the $1,650 or $1,650, like up to that range, that will not be the college's revenue. So I just wanted to make it clear that we would be acting as an agent effectively on behalf of the new provider. So we will be collecting that money, but it will not be on our books as revenue. So it will just be passed on to the new provider. And I just want to make sure that there's some clarity about that, because although it is represented as one fee, it will not belong to us as revenue as the organization, given that this transaction is going to occur. The expectation is that that money is passed on to that new provider. At the same time, if for some reason the transaction fell apart, which I don't think is going to happen, but at the end of the day, we have to plan accordingly. It also positions the college in a way that we are protected from the fact that we might end up in a situation where we didn't collect enough money to still continue to run and operate the program. And in that situation, if things came back and were under our umbrella in the worst case scenario, which I truly do not believe is going to take place, at least then we have the resources, and then we can talk about what we would do with those excess dollars. But the other thing that I want to make clear is that although there's an increase here, and I know that the perception is going to be challenging in terms of circulation, it's not us setting that fee, it's the new provider. So we're just facilitating the fee that is going to be required under the new provider's purview. I hope that that helps add some context and clarity, and I'm happy to address further questions if I can support them. But I think Dan has a good handle on this too. And thank you, Mark, for your comments.
Thank you for that clarification. Anthony Mayer, you're next on my list.
Thank you, Mr. Chair. Yeah, I'm going to sort of support what Rod and Aaron were saying, is that I am extremely concerned about the optics here. And as I was more concerned, and then as I was listening to the presentation, I got even more concerned. There's a kind of simple math here. If we accept that the true cost of PLP is not $1,000 a registrant, but $1,400 a registrant, and we made $9 million last year, that essentially means that our regulatory fee is too high already. And so there's no need to increase the fee when all we're going to be doing is regulation, unless there's a hell of a lot of inefficiency that's going to come from the divestment. So I understand all the math here. I am not at all concerned about the reality of increasing the fee for the PLP type insurance component, but I am not supportive of this particular increase, and I am absolutely going to vote against it. I don't think I have voted against anything since I've been on council. Thank you.
Thank you. Dan, do you want to respond?
Yes, and Anthony, I don't have enough information to completely correct your math, but I do want to say that one factor is the PLP loss provision, where we budgeted 7 million and it came in around 4 million. So that's not typical. We usually budget 7 million and it comes in higher, or 8 million and it comes in higher. So this was a year of that anomaly where that loss provision that's an expense on our books came in about $3 million less. The other thing is we have revenue earned from our investments, and our investments are directly related to sitting on a high reserve that is there to support claims for PLP. So there are a couple of significant contributing factors to that surplus. But I'll take your point that we're always looking at ways that we can be more efficient within the regulatory processes as well. Go ahead, but I have one more comment.
Just a brief follow-up. I mean, I understand what you're saying. I'm following all the numbers, but the reality is we're registering more dentists than we expected, and our expenses are not growing. We have economies of scale in Ontario. That's why our fees should actually be lower. That's just my point.
My final point, and again, this is up to council when you get to the vote, is if you do vote against this, then you need to do so knowing that we may be faced with a situation down the road. And I'm not saying it's 100%, but we may be faced with a situation down the road where we have very significant financial issues to bring back to this council. So I just want you to know that before you go into the vote. I'm not suggesting either way, which way you vote, but that's what the Finance Committee, and I think what Mark explained earlier, that's what the Finance Committee considered in April or May.
Thank you. Jamie.
Yes, I've heard a few things that I'd like to acknowledge. First of all, the success of the PLP program in terms of budgeting a high number and then successfully negotiating much lower results in terms of lawsuits. That's point number one. Point number two is this program hasn't been costed properly within the organization. So in the communication strategy as we go out to the dentists, I think if there was a quantum associated with the under budgeted aspect of the PLP to date, might be helpful. There are lots of reasons why we should probably vote for this. No question about it. The success of the deal actually could very much depend on this. So, if we communicate as best we can with all the available information, and I just suggest that we make it clear. And I think, Anthony, you'll have an appreciation for the aspect of the program that hasn't been funded properly. And I'm not pointing fingers at anybody. I'm just saying that's a reality of the program. We've already looked at that tax, employee costs, et cetera, et cetera. Thank you.
Thank you. Vivian?
Thank you, Hanno. I just have a point regarding, the fee sounds like quite a bit to dentists. And I was just wondering, once PLP is not in the picture, does it mean that there will be a drop in fees for the dentists? Or is it the fact that Mark was saying there could be like a lot of claims and then we might be in a deficit, that there will be no dropping in the fees at all?
Who can I direct that question to? Dan?
Yeah, I can start. Once PLP is divested, then the college will collect the regulatory component only. So let's just assume for the sake of argument, it stays at $21.70, but that's the amount that we will collect. And dentists will also pay a different entity a fee for their liability insurance, which is currently at the $1,400 plus all the other amounts that went into that $100 to $150 additional amount, premium taxes and so on. So the dentist will be paying those two pieces to different bodies. And that's the same in most other provinces in Canada, that they pay generally to two different bodies. I'm not sure if I've completely answered your question, Vivian.
Yeah, so there should be a drop. Thank you.
Okay, thank you. Daniel Fortino.
Thanks to Mark, Kelly, and Dan for providing a lot of input on the numbers side of things, which is very important to understand. I think as a member across the board, this is definitely going to be a very sensitive move that I think requires careful communication to all the members. I'm not sure how that will be done, if in terms of what data and rationale we're going to put out to the member and how that's going to be laid out and how much information they actually need to be comfortable with the decision we make. I'm not sure if there's going to be benchmark data that's going to be provided. But speaking, as a member, unfortunately, a lot of them will probably expect with the divestment the fee to reduce, not increase. So it's going to be quite sensitive putting that out there. It's just how we communicate is going to be of utmost importance. So if we have, I don't know if we have ideas how that's going to be presented, but that's kind of an important topic to discuss.
Thank you. Nalan. Nalan, you're muted.
Yeah, sorry, Hanno. Thank you. According to CPMF, we have to maintain a minimum amount in the operating reserve, a minimum amount. But is there also a maximum amount? So if the surplus or the funds that the RCDS gets goes past that maximum amount, do we have a process in place in terms of how we're going to deal with that when we go over the maximum? Do we have something like that?
I'm not sure now, and look, I'll look to Jeff or Kelly to jump in. I'm not sure there's a maximum amount. I think this is, and we've taken advice of our auditors in terms of what's our comfort level with the surplus. And we've also been very careful to make sure that the surplus is designated to various activities, whether it's the operating reserve that we've talked about, whether it's the PLP liabilities that we have on the books. So I don't think there is a maximum in the sense that there's a number that we can't go over. But I also think that because of the period of time that we're in right now, where we've got a number of moving parts, rapidly moving parts, we will reach a level in, I'm hopeful, a year or so when the PLP divestment is done, where we will have, as I've said earlier, more certainty in terms of what are we actually dealing with financially for some of these component parts, and how do we actually level out if we need to level out in the different areas that we will continue to be responsible for. I think, Kelly, you may have been wanting to jump in, or maybe Jeff, about the maximum amount that you asked about, and then I'll turn it over to one of them.
You want to start, Kelly?
Sure. I was just going to reference in my slides, and what I talked about in the reserve from best practices from the auditors is, that you can have a reserve up to 12 months of operating expenses. I think the reality is, even with some shifts at 25% right now, we're not going to exceed a full year worth of operating expenses. Because, probably you won't remember because there's been so much material, but in December, we did provide a multi-year forecast. And in that forecast, it actually had removed PLP. And just to give you some context, that might result in about operating expenses of around 31 million. And so even if once you take out amortization, which is one of those administrative costs, you're talking about $30 million, and our operating reserve, what we are bringing it up to is 7.5. We're not going to be anywhere close to that threshold. So I think we're more than adequately not going to go above. And there hasn't been a plan, because honestly, we've been working so hard to just meet the minimum target that we haven't even fathomed the idea of being over 12 months. But I also, while I have the floor, wanted to also hopefully address some of the other comments about where we might land in terms of what a regulatory fee is. So when I did do that multi-year forecast, the assumption at the time was that we would have CPI still applied to the regulatory fee. But because we're suspending that, it actually would drop the projected forecasted surplus without PLP in the picture to be only between like 470 to 650,000, depending on what the actual CPI rate would have been applied. So I just wanted to make sure that it's clear that without PLP in the picture, we're not going to have some big, surplus year, or that our regulatory fees are not well overstated, because they're just appropriate to cover the costs that have been projected, pending that they have not changed. So that was a secondary question to something else that came up earlier.
Jeff, maybe I'll just add anything.
Yeah, maybe I'll just chime in for a second. So Leslie has been working very hard in developing a full communication plan from A to Z. So I think that is well in hand. In terms of reserves, I think we need to get through this PLP process, and then we can look at, some financial long-range planning. There might be other reserves we need when PLP goes away. But just to confirm again, the fee is being set by the bidder. This is not a fee that's coming to the college. So, and that will be made clear in the communication plan as well.
Thank you. I still have 4 people on my speakers list, and then we have 3 motions we need to entertain. So Rod, you're next, please.
Just a quick summary. Thank you. And first of all, I just want to say, as a former FAR member and a CPA, I fully agree with Mark's team and the financial imperative to do what we have to do here. My comment relates more to our discussions last week, and which I know have not been summarized yet. But Dan, as we, the environment where we think we're heading, where it's, as I mentioned, collaborative, more trusting, more engaging, and yet around the room, and I heard this somewhat from Daniel as well. Our value add as a registrar is I'm not saying questionable, but is challenged once in a while. There's still some who perceive us as the enforcer rather than a partner, which we more and more would like to be as we head down the road. So whether we like it or not, this PLP move to some extent, and I think in many, decreases the value add that the registrar provides at the moment, and hence we're going the wrong way. So this boils down to, perhaps, I haven't got the solution, but it's probably, let's make damn sure our rollout communication strategy is well thought of with that in mind.
Thank you. Neil.
Thank you. Just to, Rod brings up a good point on trust, and to go back to Anthony's point, we could have masked this cost and then go into a yo-yo effect of increasing the fees to the membership. But the fact that we're, according to our auditors, short of our reserves, we're being transparent. We are disseminating the whole fee to our membership, and then eventually, once we do, as Dan said, reach a clear stabilization, that will enable us to either keep fees at bay or reduce them if need be. Once our commitments have been met to the reserve, to our potential risk of divestment, and a true determination of costs.
Thank you. Aaron. Aaron. Oh, you're muted, Aaron.
Sorry. I appreciate there's a lot of risk and a lot of unknowns involved in this process. But I feel that if there's a big risk that it's going to put us into a detrimental financial situation, and we think that there's a good chance that this could happen, I think that council should come back to the table in another session and flesh that out a little bit more and discuss what to do about it if it looks like it's looming. I also think we should be considering other revenue sources besides membership fees. I want to say it's an easy way to generate supplemental revenue, but it shouldn't be the only way that we do this, because I think the relationship is important, and it almost sets the precedent saying that, okay, well, if we need more money, if we have a shortfall, we'll just get everybody to pay more, and then that'll fix everything. I don't think that should be the go-to solution that we have. So I think we need to look at the budget. Maybe we come up with other innovative revenue streams to cover off some of these things, and maybe even future projects that we may want down the road.
Thank you. And Leslie, do you want to respond to that or just be on the speakers list? Leslie?
Just the speakers list. Thank you.
Okay, perfect. Osama?
I agree with Mark, I think, and Jamie, that the RCDSOs shouldn't be fronting the dollars on this from the reserve and the surplus. I also don't think that the stakeholders should be responsible for the difference as well. I think there needs to be some sort of negotiation with the buyer. Ultimately, this is although they've checked off many boxes in terms of their role, there needs to be a deeper dive with regards to this specific issue. Thank you.
Dan, do you want to respond?
Yeah, I just first I want council to be careful in terms of comments right now, just because I know that council has had an opportunity to hear some confidential information. I just want to be careful that we're not breaching any confidentiality in this forum. I will also say that this is a year and a half of discussion, of which the PRG has been actively involved and engaged in discussions along the way. So I don't think we can say at this point, when we are deep into negotiations, that we can look to changing course on this particular area that readily. I think the fallback is the college will support this financial piece, which means if you don't want this to be membership focused, then the college will still be able to continue these negotiations and will be in a position of having to transfer $5 million or more that we haven't collected. So, and that's your decision. Look, I'm not trying to say good, bad, or indifferent, but that's your decision to make. But I want to make sure you have full information. And I will look to Kelly and Jeff to make sure that those financials are accurate. But I think that we need to be very cautious about trying to redirect negotiations that have been going on now for some time, direction previously for the entities that were involved, and now negotiations, and also to be aware of what this means to the college in terms of financial and fiduciary duty.
Yeah, and just to chime in, the amount is closer to 6 million. And we would only be able to do that 1 year if that.
Thank you. Robin.
I think aesthetically, the percentage is a big part of the issue. It's a big jump. I don't know whether it should be 50-50 with the college or something like that, but I think aesthetically that's a hard sell. And no matter how you print it, the dentists run businesses, they're going to do the math, and they're going to see that number.
Harinder?
Thank you. Thank you, Hannah. I think this, Dan mentioned those 8 objectives we had, which membership wanted and the college wanted. It was driven by actually the membership, what they wanted out of this program after divestment. They wanted a similar program like PLP, all the ingredients of a PLP. And going back to negotiate with the entity we are negotiating with will not be possible probably. Number one. Number two, I know optics are difficult, big jump. I have had a chance to talk about this at General Council meeting at ODA. And Dr. Fatino's point, actually, as a matter of fact, everybody expect that there's going to be a raise in the insurance part of the fee, not decrease. I don't know how somebody will expect it to decrease. Thirdly, if you look around the country, we are nowhere any more than any other jurisdiction paying this insurance fee. So my request to the council is that we go ahead with this. Leslie and Dan and I and others have a communication strategy explaining to the membership why it is so. And I know that we will be successful in explaining. This is insurance part of the fee. It has nothing to do with the regulatory part. And we are even suspending the COLA this year. And Osama, we are only collecting this year, not next year. That will be that entity which takes over will be collecting directly from the membership. Thank you.
Leslie.
Thank you. I just wanted to, first of all, thank you, Council, for your emphasis on the importance of communications and underlining the need to do this right. I'll point you to a couple of items that were in your briefing material. One was the comparative chart across Canada, which outlines that professional liability fees are by and large more expensive in other provinces. And also the chart in your briefing note that outlines the number of times that the college has increased fees over the last, since 2027, and it's very few times. So I really appreciate your advice. We have been communicating about this since 2023. We've been consulting with the membership. Is the news of an increase, specific increase, going to be news? Yes. But this entire process has been communicated since 2023. So we're regularly speaking to the membership. Anyway, thank you so much for all your input on the communications front. I really appreciate it.
Thank you, Leslie. I have 3 people on my speakers list, and then I'm going to call for us to, or for council to consider motion number 12. First person on my speakers list is Anthony Lisho.
Thank you, Hanno. Harinder and Leslie have just mentioned a lot of the points that I was going to mention, but I'm going to be very brief. First of all, a reminder that we will not be the highest in the country. There are entities across the country that will be higher than us for fee. In terms of the reserve, we won't have a 12-month reserve. We're lucky if we have perhaps maybe 5 or 6 months as things stand now. And thirdly, as Dan has mentioned a number of times in this conversation, be patient, that let the process evolve. And I think that things will become a lot clearer as we move forward to that September, October time period where we have to actually come down with an actual number. And also the fact that not only to be patient, but to know that we have worked very, very hard, and with a lot of staff consultation, especially from the finance and the auditors in this case here. They've also weighed in on the process. And the communication part, from Leslie's standpoint, will be strong to prove the case that this is fair and equitable. Thank you.
Thank you. So I'm going to go to Anthony Mayer, then Daniel Fortino, and then I'm going to put the motion in front of council. So Anthony Mayer.
Thank you, Mr. Chair. Sorry to keep harping on this, but I remember the times when the college was losing money and we had to increase the fees. And I remember personally, I was not involved at all. Like it was annoying but you understand when the organization is losing money that the fees have to go up. So this is what I think is lost here in this discussion, is I do not feel like currently we appreciate how difficult it's going to be to communicate to people that we made $9 million surplus, $7 million over budget, and we're going to increase the fees regardless of where that fee is going to. But we are collecting the fee, which is 20% higher. The optics of that are just not going to sell with the membership on just a very basic level. People are not going to drill down into the details. They're just going to look at those things and they're going to blow their lids. That's my opinion. Thank you. Daniel Fortino.
Yeah, so Anthony just actually mentioned a lot of the points I was going to say in response to Dr. Sandhu. It's just a matter of communicating that RCDSO is collecting the entire fee. So as a member, they're not going to look at the nitty-gritty or what the breakdown of that fee is, and that's going to become very confusing and frustrating as the member. So that's going to be difficult to communicate. I'm not sure how that will be done, but that really has to be properly laid out. I just wanted to mention that, and it's been kind of oversaid already, but I think that's an important part of this for sure. Thank you.
Judy.
Thank you, Hanno. I just have a comment on, I guess, what I've been watching today throughout this meeting, and that is that with both with respect to governance and now finance, the council's been asked to vote on some significant initiatives, but they're not fully formed. And that's why I've heard people asking questions in terms of, what is the substance going to look like? And despite the fact that the substance isn't fleshed out yet, we're being asked to approve it. And I, as I said, I heard this in terms of the governance discussion, and I'm hearing it now. And I just think that I'm feeling that there's a sense on council that we're not ready to necessarily vote on all of these initiatives, and yet I know people are voting in favor of them, but but although for the first time in a long time, I've seen people opposing initiatives. And I just think that, on a go forward basis, maybe we have, as members of the different committees and as a council as a whole, we have to think in terms of presenting fully fleshed ideas and concepts and programs that are being changed in a significant way. That's all. It's just really a general comment.
Thank you, Judy. Mark, you're going to be the last one to comment before I call the question.
And I'll make it short. Thank you, Hanno. As a member of council, I reflect as the conversation unfolds. For my part, I reflect on my fiduciary duty. And when we talk about governance, our fiduciary duty as fellow members of council is to the college. A lot of the discussion and the reservation and the angst expressed is in relation to the professional members registered with the college. My reflections are that my fiduciary duty is to the college. There is a dotted line to stakeholders. Those stakeholders certainly include the professional members. I would suggest that it's not a dotted line to the public, but rather a solid line between the college and the public's interests. So in how I'm guided, I'm trying to share with fellow members of council in this decision-making and in your decision that you're about to make, I'm guided by what my view is my fiduciary duty is as a member of this board, and it's to the college and the best interest of the college, notwithstanding key stakeholders, and those being certainly professional members. And on that, though, back to you, Hanno.
Okay, thank you. I'm going to ask that motion number 12, be put on the screen, please. And for your consideration, council, motion number 12 is that council supports an increase in the 2026 annual fee to be paid by members and delegates to the executive committee the authority to approve in principle bylaw amendments required to increase the annual fee paid by members, provided the increase to a member shall not exceed $650. That is moved by Anthony Lisho, seconded by Neil. This requires a simple majority. There are 21 members of council who are eligible to vote. Those in favor, please raise your virtual hand.
Sorry, can I just ask something about the motion?
Yes?
The wording of the motion? I'm just wondering whether it shouldn't specify that the up to $650 increase is to support the increase in professional liability insurance as opposed to just the overall fee, since it is targeted for that.
I'm going to throw that over to Marco in terms of or Jeff.
Hanno, I just want to just 1 second.
We can hear you, Harinder.
Yeah. So I want to support what Judy said. I think if we amend the motion and make it very clear that this part of the fee is allocated to the insurance part and not the regulatory part.
Could that be a friendly amendment?
Yes, please.
So could someone provide language for me then? How would that friendly amendment work?
I think you could probably, it's Alan, I think you could probably have, can't see the motion at the moment, simply say the increase to support the increased cost of the
liability insurance,
professional liability component.
Okay. So that is a friendly amendment. So again, I think it was Anthony Lisho and Neil. You've moved and seconded. Are you both in agreement to that friendly amendment? Okay, so that will be the motion then with that amendment. So again, it is a simple majority. Please raise your virtual hand if you are in favor. So 21 are eligible to vote. Right now, I'm seeing 12 in favor.
And
So-
Hanno, I just want to, for the record, Nazar left at 11:30, around 11:30, so it's 21.
Yes, no, I did. I took note of that, so I
Yeah.
realized it
Yeah.
is 21
No,
that we're
I just wanted to clarify for council. Thank you.
Okay, thank you. So that's 12 in favor. Those people in favor, please lower your virtual hand. Those opposed, please raise your virtual hand. 7 opposed. Please lower your virtual hands, and I will ask if there are any abstentions. Okay. 1 abstention. Thank you. That motion does carry. Next motion, please, on the screen is motion 13.
Let's go.
That council supports the suspension of the automatic consumer price index, CPI, increase on the 2026 annual fee required under Article 18.3.13.1 of Bylaw 18 and delegates to the Executive Committee the authority to approve in principle the suspension of the automatic consumer price index, CPI increase, which would otherwise be applicable to the 2026 annual fee due to the provisions of that article. And if I could have a moved by Deborah, seconded by Neil. Again, all those in favor, raise your virtual hands. I see 20 in favor. Raise your, if you could lower your virtual hands, please. Lower your virtual hands, please. Okay, those opposed? Okay, it looks just like 1. That motion is carried. And next, still under this, Adam?
Well, I think it's important that council understands something. The motions you passed are to move matters forward so that ultimately there can be circulation of any bylaw amendments that would be required to make these changes. In other words, these changes cannot be made without bylaw amendments. Either one of the first 2 you've just done. So this is to allow the executive committee to do something, which is to approve something and circulate something to members and other stakeholders for comment. But ultimately, you need a bylaw amendment to change the annual fee, and you need a bylaw amendment to suspend the automatic COLA increase, which can only be done by council by a 2/3 majority. So everyone needs to understand that it's all coming back to council ultimately to make the final determination on that 2/3 majority basis. Otherwise, if there is no 2/3 majority vote, there will be no change to the suspension if that one doesn't carry by 2/3, and there will be no change to the annual fee if that one doesn't carry.
Thanks for that additional information, Alan. If I could have motion 14 on the screen, please. And council, for your consideration, that the executive committee be directed to circulate the aforementioned proposed amendments referred to in motions 12 and 13 to members and other stakeholders for comment for at least 60 days before the proposed amendments are brought back to council for final consideration. That's moved by Brian, seconded by Neil. All those in favor, please raise your virtual hands. Uh, 20 in favor. Please lower your virtual hands. Those opposed? 1 opposed. Thank you. We are running behind schedule, but I'm going to suggest we go to the next item, which is item number 10. Then we will do a quick break and come back and deal with the rest of the agenda. So the next item on your agenda concerns the appointment of the National Dental Assisting Examining Board. And I'm going to ask Angelo if you could please.
Hannah, Jamie wants to say something before that.
Oh, Jamie?
Yeah, through you, Mr. Chair, to Alan. You made the comment, which is an important comment, that for the people who have questions and who have possible suggestions before the bylaws are written, how does that happen? How in fact does one, we've seen some opposition to in a few votes here. How are their opinions expressed to those creating the bylaw? Thank you.
Well, the members of the executive committee who have been delegated the authority to set the fee in principle for circulation, okay, have heard all the comments that were made. So they have that input. If additional comments are to be made to them, then members of council should direct them to the executive committee, perhaps through the registrar, I would think, so that they have any additional information that they need to have before they approve the fee in principle and direct the drafting of the bylaw amendments necessary to incorporate that. Because the expectation at the end of the day is if it isn't something that 2/3 of the council will approve, then you're not getting any annual fee increase. So that's what I'm trying to bring forward to people to understand in approaching this. It's a significant amount of work to make those bylaw changes, and you can't just do it on the fly because you have to have circulated them in advance for comment. So I think the answer is you direct those comments back to the executive committee for their consideration if they're not ones that have already been made.
Thank you. So next item on the, Dan.
No, that's okay, Hannah. Just please carry on with the next item.
The next item deals with the college's appointment to the National Dental Assisting Examining Board, the NDAEB, and I'm going to ask Angelo, you may have done that already, if you could put Andrea into a waiting room. And the NDAEB is the independent board responsible for developing and administrating the national examination for dental assistants in Canada. The NDAEB expressed an interest in having the RCDSO participate on its board of directors, and materials for that can be found on pages 383 to 384. This is an item for your decision, and Dan, I'm just going to quickly turn it over to you, please.
Thank you, Hannah, and I'll be very fast. The NDAEB is comparable to the NDEB, although this college, as you know, does not regulate dental assistants. We have been asked, since I started in this role, several times if we would resume our seat on that board. It has been empty for a few years. It predates me. And over the last few years, as certain things have happened within the environment around dental assistants, obviously there are issues that relate to supply of dental assistants, regulation or not regulation, things that might relate to amalgamation in Ontario, of which there is absolutely nothing going on to my knowledge. But I thought it might be important for us to have a seat at that table where there are some other registrars from other provinces as well. But at this point, to appoint Andrea as the deputy registrar to that seat, and if things change in the environment and there's something that we need to consider in terms of who should be at that table, we can obviously bring that back. I went to the executive committee a couple of months ago and they supported this. So I am bringing it here to council to ask you to consider supporting this as well. And there is a motion.
Thank you. Any questions for Dan? Neil? Oh, so could I have the motion then on the screen, please? Motion 15, that council confirms Andrea Foti Deputy Registrar as the RCDSO representative to the Board of Directors of the National Dental Assisting Examining Board to be reviewed no later than December 31st, 2026. That's moved by Neil, seconded by Ram. All those in favor, please raise your virtual hand. And that is carried unanimously. Thank you very much. Council, I know we're running behind schedule and our intended adjournment time was 1:30. We may exceed that a little bit. So I'm going to propose we take just a 10-minute break. It is now 12:47. If we could reconvene at 12:57, and then we will deal with the items that are left on the schedule. So please just turn off your cameras and your video, and we will be back in 10 minutes. Thank you. To take us back to the agenda, item number 11, please. And because the agenda was a very full agenda, and I just want to let council know we will be deferring item number 12 to our September meeting, but you have had the opportunity to review that. So if you already have input regarding item number 12, please feel free to submit that to Denny, and that will be incorporated into what comes to our September meeting. So item number 12 will be deferred to September, but we are going back to item number 11. And that is our ongoing work on the modernization of practice standards under 2023 to 2025 strategic plan. This item concerns the draft standard of practice on managing conflicts and ending the patient-dentist relationship. Council will be asked for feedback on the draft standard and for approval to release the new standard or the new draft standard for consultation. The material in your package can be found on pages 385 to 399. This item is for council's feedback and decision. Denny Ogurindi, policy analyst, will walk council through this material. So Denny, I'm turning it over to you now, please.
Okay, great. Thank you, Hanno. Good afternoon, everyone. In the interest of time, I am going to move a little bit more quickly through this material, but this is not to rush your decision-making in any way. And everything that I will be speaking to and that's covered on the slides is captured in your meeting materials. That said, I can provide any additional information on anything I move through quickly as part of the discussion if you'd like me to revisit anything. So moving into the agenda. So I'll start by providing some background on where we're at in the standards review and modernization process, providing an overview of some research that informed the revised draft standard itself, and then we'll move into a discussion and decision for council. As a reminder, the policy team undertook a risk-based prioritization exercise in 2023 to determine which standards and other resources should be prioritized for review and development. The Maintaining a Professional Patient-Dentist Relationship Practice Advisory was identified as high priority for review at that time and was approved by QAC in January of 2024 to be reviewed and updated into a new standard of practice. Now, the current practice advisory covers 5 main topics: general principles for patient-dentist relationships, advice for building the relationship and resolving conflicts, steps for dismissing a patient, and advice for moving beyond a professional patient-dentist relationship. In our review of the document, we identified some areas where the advisory could be improved. So as examples, the document includes scenarios and advice, but not requirements for addressing conflicts or ending the dentist-patient relationship. Moreover, it made sense to prioritize the modernization of this document now, as a new draft standard related to accepting new patients is currently being developed. So it's important to ensure consistency between the two documents. This slide shows our standards review and development process, and I won't go through it in the interest of time. I'll note that as part of the drafting stage for this document, we did seek input from our standing policy working group, to which some of you are members, and 2 clinical leads, so Dr. Helene Goldberg and Dr. Mary Colaveras. So they provided input into this work. That brings us to our current stage, which involves seeking your approval to consult externally on the new draft standard. So starting off with some of our key findings from our jurisdictional scan, we reviewed, as per our usual process, Canadian and international dental regulatory authorities, as well as several Ontario regulatory health colleges. In general, our current guidance is consistent with those of other regulatory colleges that address conflict management and ending the practitioner-patient relationship. Topics most commonly addressed by regulators include strategies for professional communication, steps to resolve conflicts, situations where it's appropriate or inappropriate to end the relationship, and steps for ending the relationship. Through our literature review, we found that good communication skills, such as active listening, acknowledging patients' feelings and concerns, are paramount both when trying to resolve conflicts, but also when trying to reestablish boundaries that may have been crossed or violated unintentionally. With respect to ending the relationship, some important themes include being clear with patients about why the relationship is ending and supporting patients to find another practitioner and with interim emergency care as needed until the patient can find a new practitioner. That brings us to our preliminary consultation, which sought feedback on the current document, as well as general feedback on topics captured by the advisory. The consultation took place via an online survey. It was open for 60 days, and we received 168 responses in total, most of them through the survey and one over email. The majority of the feedback was from dentists, which is common for these kinds of surveys. So about 69% was from general dentists, with 16% from specialist dentists, and 11% of feedback was from respondents who identified as members of the public. We also heard from two organizations, the Ontario Dental Association, whose main feedback was twofold. One, that the document should maintain that it may be best for a patient-dentist relationship to end if it's no longer trusting. And two, that it should be more, the document should be more informative in situations where patients and our staff safety is threatened due to patient behavior. So we've addressed both these comments in the new draft. We also received some feedback from the Ontario Association of Interval and Transition Homes on the topic of trauma and violence-informed care. Most respondents, so about 71%, indicated through the survey that they found the current practice advisory to be extremely clear or very clear. Most also found that it includes the important and relevant topics related to maintaining and ending patient-dentist relationships. And most find that all or some of the expectations in the current practice advisory are reasonable for dentists. So all of this feedback was very encouraging. Respondents also shared feedback, so qualitative feedback for how the document can be improved. Some of the key feedback included that we should provide clear timelines for providing emergency care. Based on feedback from our Standing Policy Working Group, we've heard that it's most important to clarify that dentists can set a time limit informed by their patient's circumstances. So we've addressed that in the draft. It was also noted that we should clarify when and how dismissal should take place, which we've done in this draft document. On the topic of respondent experiences resolving conflicts, we heard that both dentists and the public value the dentist speaking with the patient directly, either in person or electronically, acknowledging the patient's perspectives, and also discussing options to resolve the conflict or disagreement with the patient. With respect to ending the relationship, generally dentists and public respondents do see value in dentists providing written communication regarding the end of the relationship, including the rationale for the end of the relationship. And they see an offer to provide interim emergency care as important when ending the professional relationship. One topic that we looked into a little bit more specifically was ending specialist-patient relationships, which was not addressed by the current document, as the college receives questions on the topic of ending these kinds of relationships, particularly in the context of orthodontic treatment. So for this reason, we asked dentist respondents as part of our preliminary survey if there are unique considerations for ending a relationship between a patient and a specialist dentist, so for example, an orthodontist, either prior to or as part of the natural or expected end of care. Of all the dentists who responded to this question, the majority, so general dentists and specialist dentists included, indicated that they weren't actually sure if there were unique considerations here. However, among the specialist respondents, and again, we had about 23, so it's a relatively small number that answered this question, but the majority, so 52%, indicated that they did think there were unique considerations for ending these kinds of relationships. So based on this input, we did bring this topic to our Standing Policy Working Group and specifically to members who are dental specialists for their input. The Standing Policy Working Group advised on some key considerations for this scenario. The first point being that what is most relevant here is if the patient is undergoing long-term active treatment and not whether the patient is receiving care from a specialist. So you'll see this language reflected in the draft. It was also noted that the patient really needs to be stable, especially if there will be a period of time between providers, that communication regarding the oral health status of the patient in relation to any agreed upon treatment goals need to be made clear to the patient, including things like if they require or may require any retentive appliances, for example, and also that really good documentation is important. So we've reflected these considerations in the draft document. We also sought feedback from departments within the college on topics related to the current practice advisory. So from practice advisory service, we heard that guidance around the following could be helpful: conflict resolution, a duty to take on patients in situations of emergency, and also transitioning into retirement. Similarly, the Professional Conduct and Regulatory Affairs Department thought that it would be helpful to have general guidance about conduct and good communication, that the new standard should be clear about steps to manage a conflict rather than just outlining considerations, and that the standard should include a reminder about patient confidentiality. So some of these things we heard through other avenues, but again, we've tried to address these in the draft standard. Also, per our usual standards review and development process, we reviewed complaints and decisions from the Inquiries, Complaints, and Reports Committee on topics related to conflicts and ending the dentist-patient relationship. So when ending the dentist-patient relationship, the ICRC is generally concerned with whether a registrant followed the steps in the practice advisory to dismiss a patient, abandon a patient mid-treatment, or dismissed a patient where it is questionable if the dismissal was warranted. So for example, where the dismissal follows a negative online review, or if the dentist dismisses a patient because the patient asks a lot of questions about their treatment and they feel like the relationship is no longer trusting. Risks to patients are generally considered to be low, minimal, or non-existent by the ICRC regarding impacts of communication issues or improper dismissal on patient care, except where the dentist communication is aggressive or unprofessional, where the dentist has not maintained boundaries in their professional relationship with a patient, or if the dentist has abandoned the patient mid-treatment. So having said all that, we're now going to move into key changes that have been made from the current practice advisory into the new draft standard. So from the current practice advisory, we have retained and updated general principles, advice for resolving conflicts prior to ending the relationship, and steps to end the relationship. We have removed content relating to building a relationship only because that content is being transitioned into a separate standalone document that Council will hear more about in the future. We have also removed the scenarios related to resolving conflicts, as you might have seen, as those are going to be addressed by a series of FAQs as well as standalone case scenarios. So we have an opportunity to reflect on and update those later. And we also have removed content related to moving beyond a professional relationship, as this is addressed by the new Prevention of Boundary Violations and Sexual Abuse standard. In terms of what we have added for clarity, we have included steps to resolve conflicts, including unintentional boundary violations, which was a topic that came up at our last council meeting in the context of the Prevention of Boundary Violations and Sexual Abuse standard. We've also addressed situations where dentists must not end the relationship. And then for improved comprehensiveness, we have included, among others, requirements for dismissal of patients undergoing long-term active treatment, as I mentioned, and requirements related to ending the relationship due to changes in a dentist's employment. So for retirement, as an example. I mentioned earlier the role of our standing policy working group and clinical leads, but the draft standard was also reviewed by the Patient Relations Committee in April and by the Quality Assurance Committee in May, the latter for approval to share this with Council for your feedback and to seek approval for external consultation. Both committees supported the new draft standard and appreciated its comprehensiveness, but they also suggested additional topics for future case scenarios and/or FAQs. These include, but are not limited to, communication strategies to address a conflict with a patient, considerations for managing patients who dictate or refuse treatment, and examples of circumstances where a dentist may be considering ending the relationship. So where a patient exhibits rude or disruptive behavior, they fail to keep appointments or pay for treatment, or they're unsatisfied with treatment outcomes. This slide is just to say that future case scenarios, FAQs, and a revised sample dismissal letter will follow should the standard be approved by Council. These resources can all be treated as living documents and they don't require Council approval. Closer to when the standard is published, other knowledge translation tactics such as RCDSO Connect sessions, for example, can be used to help ensure dentists are aware of the new and revised expectations and help them effectively incorporate them into their practice. So today we'll have a discussion and decision on the release of this standard for external consultation. If Council approves, it'll be released for external consultation for 60 days. After that, the draft standard will be revised based on input both from Council today and consultation feedback, and it'll be reshared with Council for final approval. So Moving into the discussion and decision, our main question is, does council have any feedback on the new draft standard? And before I bring this slide down, I just want to note that blue comment at the bottom. So I alluded to this on the previous slide, but should council approve the release of the draft standard for external consultation, any additional feedback that council members provide will be considered alongside consultation feedback when the document is revised. So you'll have a chance to see your feedback considered as part of the revised document later on. Okay, great.
Thank you so much for that, Denny. Now I'm going to look to council members to see if you have any questions or comments to share with Denny and her team. Deborah?
Just wanted to mention it's an excellent document put together, and I look forward to it going forward. Thank you.
Thank you.
Noah?
Yes, thank you. Great document, and I'm really happy that there is harmony between this document and the what we've been working on at the professionalism working group, the standards of professionalism and accepting new patients. So on the other side, and perhaps now that it's going to be released for feedback, maybe the two groups can work together or talk together about the content of both documents just to ensure that they go hand in hand together. Thank you.
Thank you. Any other questions or comments? Thank you again, Denny, for that. And again, just a reminder that we have deferred item number 12. So having had reviewed it, if you have opinions or comments that you want to share with Denny and her team, please forward them to her, and they will then also be taken into account for the presentation that will come forward at our September meeting. And since I see no one else on my speakers list, if I could ask that motion number 16 be put on the screen, please, for council's consideration. That council approves the release of the draft standard of practice, managing conflicts and ending the patient-dentist relationship as appended for external consultation. And that's moved by Brian, seconded by Noha. All those in favor, please raise your virtual hands. I have 18 in favor. So if people could lower their virtual hands, because I think there are 20 people here that should be voting. So if you are voting against, please indicate. 1 against. And if you are...
I don't think Peter's against.
Oh.
You're on mute, Peter.
Yeah, I hit about 30 buttons before I hit the hand.
Okay. In
Thanks.
that case, thank you for that, Peter. In that case, it carried unanimously. So we are good.
Thank you.
Thank you, Denny. And so we're going to skip now to item number 13 on your agenda, which is risk management. And this is in regard to the RCDSO Risk Report 2025. One of the council's key responsibilities is overseeing risks that could impact the organization and its strategic priorities. Risk reports provide guidance to the college at both the operational and strategic decision-making levels.
Okay, should I just take it, Hanno, from here?
Please do, Jeff.
Okay, thank you. So in the, I'll just provide some context for what you have before you in the BN, which is our list of 2025 high risks for the college. And this is the same list that was presented in December of last year. So it might look familiar, but we have added 1 new risk. So the 8 current risks that you've seen before have been updated. In the existing controls column is we've strengthened controls for several of the risks over the past 6 months. So an example of that would be under the privacy risk on page 453. Under existing controls, we've added that all staff have now undertaken privacy training through a mandatory module. And several of the other risks also have increased controls of the past 6 months. So for our new risk, we have added a fairly broad risk related to geopolitical and external economic disruptors, with what's going on really across the globe. So that encompasses several related risks and associated adverse impacts. And you can see that risk and some of the impacts on page 454. So these have really far-reaching ramifications, and we really can't ignore this in our risk register because it impacts virtually everyone. We've also included some charts from the World Economic Forum, which illustrates the global risk landscape for 1, 2, and 10 years. And outside of environmental and climate change, we share many of the same risks. One last piece of information referred to in the BN is the development of a crisis management plan, which will help us to react quickly if a crisis occurs. So this will supplement some other documents we have, crisis documents, including a pandemic plan, a disaster recovery plan, which we have, and Leslie has done some great work on a crisis communications plan. So that's a summary of the BN, and that's my report. So back to you.
Thank you, Jeff. Any questions for Jeff on his report? Mark.
Thanks, Hanno. Hey, great commentary, great work thus far. Jeff, you and your team, thank you. Just a quick question, observation. As we develop our crisis management plan and a variety of other playbooks with regards to navigating a crisis, a lesson learned in governance recently that I came across was that those documents, as far as where they're sitting electronically, in an ideal world would not be parked under the same umbrella that everything else electronically the college is sitting in, such that if there was a cyber attack, that entity would not arguably have access to the crisis management plan or the playbook. They may have access to everything else, but they wouldn't have access to those particular documents by virtue of the fact they're sitting on a, they're sitting shelved electronically and somewhere else, so to speak. I'm tabling it only out of the utmost due diligence, with a view that presumably our IT people are on top of that, and if not, just a lesson learned on my part lately.
Yeah, no, thanks for that, Mark. That's a great point. And we've talked a little bit about that, and maybe even, the senior people paper copy in their home, because sometimes you may not be able to access electronically, just like you say, especially in the college systems.
Yeah,
so
there's a few case studies floating out there right now where all the right measures were taken to have a cyber plan in place, but unfortunately, the playbook on navigating a crisis was sitting also on the same main server electronically, and they had access to it. So it defeats the whole exercise in that regard. Thank you. Yeah. Thank you, Jeff. Back to you, Hanno.
Peter?
Yeah, question for Jeff. And with regards to, there was a risk listed as a geo-economic confrontation. And oddly enough, we seem to be in the midst of one right now. Given the Canada-US relationship, I'm just wondering, has the college made any adaptation to, with regards to this confrontation that the US has created? And I'm just wondering if there's a movement to buy Canadian.
Yeah, thanks for that, Peter. In fact, we do have a Buy Canada policy or guidance for staff, and we are looking at. We don't have a lot of U.S. purchases, but we are looking at U.S. vendors, even in Canadian dollars. And if there's a Canadian alternative, we are looking at that. So, for example, our media monitoring communication that's moved to a Canadian vendor away from American one, and the output is much improved. So we're actively looking at that. There's some where you can't really move away from Microsoft, for example, but where there is an option, we're definitely looking at that.
Thank you. Any other questions for Jeff? Okay, seeing none, thank you very much for that presentation, Jeff. Council, the next item on the agenda is item number 14, as of right legislation, and it's a focused update on the college's response to proposed legislation. The Ontario Ministry of Health has invited the RCDSO to provide feedback on the Ministry of Health's proposal to enhance labor mobility for certain health professions and the expansion of the as of right rules. The material for this can be found on pages 455 to 459 of your package, and this item is for Council's information, and I'm going to turn it over to you, Dan, for any further comments.
Nothing further. I mentioned it this morning in my report.
Okay, thank you for that. Next item on the agenda, number 15, is just a reminder that the 2026 council meeting dates are in your package at page 460. At this point in time, I'm also going to pause for a moment to see if there's any other business that needs to be discussed. Seeing none, we have come to the end of our agenda. Oh, Harinder, I'm going to turn it over to you, please.
Hello, thank you so much for your leadership in running this meeting. I also want to thank all the council members. We heard their views and feedback on the various issues we discussed. It was, in many ways, as Judy has mentioned, others have mentioned, within our council board. It is always healthy when people have diverse views on matters, but at the same time, there'll be further deliberation on some of the feedback. Executive will meet and talk about it, and hopefully at the end we will all come to the same conclusion. Just keeping in mind that our job is public interest. We want to be very supportive of our membership, and we will continue to do that. But there's some fiduciary duty we have to the college and the public. We must keep in mind all the time, and we cannot budge from that. Thank you again for all, and have a great rest of the summer. We'll see you in September. Thank you.
Thanks, Harinder. Well done, well done.
Thank you for your comments, Harinder. A reminder to council that our next meeting will be a hybrid meeting and will take place on Thursday, September 18th. And again, as usual, when we meet in Toronto, it will be in person at the Vantage Venues, 150 King Street West, but we will also be live streaming the meeting. And I would also like to echo Harinder's comments to council for your incredible participation and your thorough participation today. I would also like to do a shout out to staff, not only those whose faces and names we see on screen, but all of those who work for them or with them and whose faces and names we don't see, for the Herculean task of putting all the information together and for the preparing and the running of this meeting. So this could not be done without the incredible staff at the college. So on behalf of all council, our sincere thanks and appreciation to them. And the very last item on the agenda, council, is a motion to adjourn, and that's moved by Robin, seconded by Mark. All those in favor, please raise your virtual hand. And that motion is carried, and I echo Harinder's comments. Have a wonderful summer, have a healthy and happy summer, and we look forward to seeing you all again come September.
Thank you,
Well done,
everybody.
Anna.
Thank you, Hannah.